My name is Irvin Clark, and I serve Florida State University, Panama City as the Associate Dean of Student and Strategic Initiatives, and we are in year 7. Can you believe that? 7 years now. Come on, I think that deserves a big round of applause. You know, and a person just walking in the door 7 years ago and immediately seeing the need and working with Northwest Florida Health and Life Management and talking with our mental health counselor and seeing all of the challenges and stuff that we have here, going through a Cat 5 hurricane, surviving COVID, being there for our neighbors to the south of us and those to the north of us, dealing with the tragedies of hurricanes, but yet here we are. And that's not even talking about all of those things that are in between, just life itself. Aches and pains, Dr. Poland, of bad hips, isn't that right? Does something to our head. Just life. Just life. What you all do in your commitment to this saves lives. And I want to thank each and every last one of you for your commitment to making this program a success. Oh, I am claiming that, Brother Michael. Let's claim it. But then also say on behalf of the administration here at Florida State University, Panama City, I want to welcome you back to FSU Panama City. And I'm asking that God continue to bless us, that we can continue to do this. And I may not be around, but for somebody to put on my headstone, man, we had the 50th anniversary for this conference because it makes just that much of a difference. I want to say thank you to Lee Bailey. There's so many people, Chaz, and my great friend Pam Perry, Dr. Poland. There's so many people out there. If I missed any names, blame it on my head and not on my heart, that played a critical role in serving on the committee to make this happen. And with that, I'm going to turn it over to my colleague, Ms. Susan Hall, who is new to us at FSU Panama City, to share some good news about some opportunities. Ms. Susan Hall.
Thanks, Irvin. All right. And thank you all for letting me come up here just for a few minutes. Again, my name's Susan Hogg, and I'm the Assistant Dean of Enrollment Management here at Panama City, FSU. And we want you all to come visit us, and we want you all to participate in some of our programs. Or if you have family members who might be interested, let them know what we have going on here, because we do have a lot of good things going on. So just a few things. We have a few spots open in our graduate programs this spring for our organizational management and corporate and public communication programs. So organizational management and corporate and public communications. So we're also having a Zoom graduate information session on Tuesday, 10/22 at noon, and we'll have virtual sessions specifically for organizational management and communication on that same day, 10/22 at 5 p.m. Right out here, we have a booth to the left, and we have QR codes for any of this information. We also have undergraduate programs, more specifically for some of you, social work. And we're having a Zoom information session for that on October 25th at 5 p.m. So join us for that. Again, you can get more information out at the table. Some other upcoming events include our new Dine and Discover series, which will be showcasing different academic programs. We have 2 next week. Business at 5 p.m. on Tuesday the 15th. That's in person, that's here, we'll feed you dinner. And then Thursday the 17th at noon for engineering programs. Again, I don't know if many of you would be interested in engineering, but you might know someone who is. We will feed you lunch, and we'll have our faculty here talking about their programs and demonstrating some of the things they do in the classroom. In addition, we have a Discovery Day on November 2nd, which will showcase a whole host of programs, including CSI, some more engineering, our underwater crime scene dive program. We'll do campus tours. We'll be showcasing and demonstrating our esports Division II team. So feel free to find out more information at the table. If you can't make any of these events, we're open Monday through Saturday now. Saturdays, we just started that. So if you can't come during the week, we'd love to see you on a Saturday. And if affordability is an issue, For undergraduate students, we are giving any first-time in college undergraduate student in Northwest Florida a $1,500 scholarship if they're admitted, right off the bat. So we'll work with families financially, and just let me know if you want to schedule an appointment. But you all have a great day. This is some great work you all are doing, and we really appreciate you being here today. Thank you.
I want to say thank you to Dr. Clark and Ms. Hogg, and we appreciate being able to be here at this beautiful FSU Panama City campus, right? I'm Lauren Anzaldo. I'm a licensed clinical social worker and the Community Engagement and Partnership Coordinator with the Gulf Coast Veterans Healthcare System, which most of you probably know more familiarly as the VA. In this role, I serve veterans here in Bay County and the other clinics of the Florida Panhandle, specifically focusing on increasing our community's capacity to identify suicide risk and prevent suicide. I'm also a member of the planning committee for this annual Suicide Awareness Summit. I appreciate Dr. Clark referencing that we'll one day be celebrating our 50th anniversary. I think we are about 13 years in at this point with having this annual event, which is a wonderful community resource and is offered free thanks to the support of those who work with us to put this on. I want to recognize and thank the other members of the Planning Committee, and Dr. Clark mentioned some of them. Of course, Mike McLaughlin, who you're going to see running around doing all kinds of things. Denise Montfort, who may be out, I'm not sure, she may be running around also doing things. Pam Perry, who you're going to hear from. Brandy Heyman, Chaz Davis, Lee Bailey, Ken Chisholm, and others. Some of these folks actually are not able to be with us today because they are doing the important work or taking care of themselves and the things that we need to do. So we're a little bit of a skeleton crew today. I think everything's going well so far, but if you notice any hiccups, it's because our planning committee's down probably by half today. I have a little bit of housekeeping that I want to share with you. For those of you who are licensed providers or healthcare providers and are receiving CEs, we do have 2 CEs available for free for today's event. They're provided through Gulf Coast State College, and they're at no charge thanks to the donors who are supporting this event. You can refer to your program. Everyone should have gotten one of these, or you can go grab one at the registration table, which has all the information about the partners who help in putting on the event, as well as those who've contributed. You must be signed in to be receiving those CEs, and there may have been a little confusion at first. There's a separate list that you have to write your profession and your license information on there. That registration sheet is going to be picked up during the conference, and those CE certificates will be printed out, and at the end of the day, when you turn in your eval at the front table, you're going to grab your certificate with your name on it. If you're not on the sign-in sheet, you will not get a certificate. Yes, Lee? Oh, yeah, anyone can go now and sign up, but it will be picked up at a point today. So just make sure you've signed in on that, where you had to write in your name and your license information. So just want to make sure you do that because we all want our free CEs if we're looking for those today. Just want to set the scene a little bit for what we're going to be doing here together today for this Suicide Awareness Summit. The team and we've been meeting for almost the entire year. I think we start meeting around January, February, and discussing how we're going to put on this event. And as we endeavored to plan a dynamic, engaging, and educational event for all of you here today, we began developing our first mission statement to guide the work. We had never developed a mission statement before, but this is something that Chaz recommended and said we might want to consider doing. So here's what we came up with. The mission of our Suicide Awareness Summit is to cultivate hope and resilience across diverse communities, empowering all of us to take meaningful action in preventing suicide. Through collaboration, education, and support, we aim to foster a culture of compassion and understanding, ensuring that none of us struggles alone. That's a pretty powerful statement. I just wanted to make sure you understood really what we're hoping to accomplish here at this event. By cultivating hope and resilience, empowering all of us to take meaningful action, we ensure that none of us struggles alone. We may struggle. All of us struggle at some point or another, but we shall not struggle alone. We just concluded Suicide Prevention Month in September, and of course, today's October 11th, right? And so it's not Suicide Prevention Month as of what the calendar tells us. This summit is usually held in September because it is part of our recognition of Suicide Prevention Month. But this lovely facility was already booked in September when we got planning way at the beginning of this year. So that's why we're here in October today. We have already reserved the space for September next year, so go ahead and mark your calendars. I think it falls on Friday, September 26th in 2025. The VA, my employer, has been executing a multi-year campaign for Suicide Prevention Month, which uses the tagline, "Don't wait, reach out." Reach out is a call to action that really flows both ways, if you think about it. For those of us who are struggling, reach out. Talk about what's going on and let someone know that you need support. Reach out to a friend or family member, a spiritual advisor, a teacher, or school counselor to share that burden that you may be experiencing. Or reach out to the Crisis Lifeline at 988 or contact the mobile response team, which are available in here with sharing resources that you'll learn more about throughout the day. But also for those of us who are loved ones and service providers and neighbors, don't wait, reach out. Reach out to the people that we care about, the people that we work with. Reach out to someone you are concerned about, or someone you've been thinking about but you haven't connected with in a while. Reach out and check in. We shall not struggle alone. Social connections with friends, family, neighbors, or colleagues improve health outcomes by 50%, according to research published by the National Library of Medicine. Social connectivity fosters hope and resilience, and it's something that we'll experience today, being together and thinking deeply about these issues throughout the summit. Once our planning team for this summit developed that powerful mission statement, we pondered the theme that would provide the framework for this gathering. This being an annual event, we attempt to bring something new to the table each time we gather. So we're not just repeating what we've done in the past, although we sometimes have things that come back. We also aim to build on and deepen the basic skills and resources that we all need to prevent suicide. A few years ago, we concentrated the summit on loss survivors. Last year, we concentrated on bystander intervention under the theme, Standing Up for Suicide Prevention. We wanted to concentrate on hope this year. Our theme for today is hope. Where do we find it? During tough times, hope can seem elusive. We wanted to shine a flashlight in the dark to illuminate places of hope. This annual summit began because the founders of this effort identified a serious community need. We have witnessed rising suicide rates nationally over the last 2 decades, and Bay County in particular is impacted by a suicide rate of nearly 25 per 100,000 people, which is higher than the Florida average of 14, and the national average of 14 suicide deaths per 100,000 people, according to the 2022 numbers, which is the most recent data available from the Florida Department of Health. Although military-connected folks represent a relatively small percentage of the overall adult population, around 10% or less, veterans continue to experience a rate of suicide at around 1.5 to 2 times higher than non-veteran adults, according to the most recent VA Suicide Prevention Annual Report, which was published in 2023. So when we consider deploying our limited resources, we want to focus on populations of highest risk, including youth and seniors. Our world today seems increasingly divisive and stressful, fraught with extreme weather. We've seen 2 storms hitting our state in the last couple of weeks. Financial challenges that strain our ability to meet basic needs such as housing and food, and difficulty accessing behavioral health care. Young people and seniors are 2 groups that may be particularly affected by these sorts of things. I would be remiss not to acknowledge that many of us and our neighbors are facing these trials, and we see you. All these issues commingle, and they impact our overall health and well-being, individually and at the community level. We know that suicide can be complicated, not attributed to one single influence, and not mitigated with just one magic solution. This work requires collaboration and intervention up the stream all the way through to the point of crisis and beyond into continuing support and care, including peer support. We have our work cut out for us, and that is why it is extremely important that we are gathered here today. While preparing these remarks recently, I was tuned in listening to the broadcast of the Mental Health America conference that took place during September. a young woman addressed the audience at the beginning of the conference. She spoke about many concerns facing her generation and acknowledged that she isn't always sure where she finds hope to continue. Then the young speaker observed that the pain and the worry that we feel about the various problems and difficulties around us is reflective of our community capacity for care and concern, our human capacity for love. We experience these emotions because we are human, and because we are human and social creatures, we can connect and invest and show up for one another and for ourselves. The young speaker encouraged her listeners, and I encourage you today, never doubt the impact of your presence. Never doubt that you are important and worthwhile, and that your voice is needed. So thank you so much for being here with us as we do this important work. We're going to be hearing from and learning some important things, and at this time, I'm going to be passing the mic on to Nikki Wotherspoon with the Substance Abuse and Mental Health Services Unit here in Florida with Department of Children and Families. And I'm really excited because Nikki's going to give us an update on 988 Florida Lifeline and the numbers and the data and the way that this important resource is improving our state. So I'm going to go ahead and turn it over to Nikki Wotherspoon. Thanks again.
Good morning. As Lauren said, I am Nikki Wotherspoon, and I am with the Department of Children and Families, Office of Substance Abuse and Mental Health. I am the SAMH Services Supervisor, and I oversee about 20 programs for community mental health and 1 or 2 substance abuse. But I'm really honored to have been asked to speak today on 988 because this is a program very near and dear to my heart. And actually, before I get started, there are 2 people I want to introduce to you folks because they're very, very important in this work. One of them is our suicide prevention coordinator, Ms. Jessica Phelps. And the other is our 988 coordinator for the state of Florida, Mr. Javi Pasalacqua. So most of you probably are already aware that 988 is the 3-digit number created by the FCC in 2020 with the intent of providing immediate access to a crisis counselor for those experiencing a behavioral health crisis or also substance abuse crises. It doesn't have to be suicidal, but also suicidal thoughts and feelings. And here in the state of Florida, we call this the 988 Florida Lifeline. Also, I want to point out that we just got our new Florida-specific logo approved last week. We're very, very excited about that. So I'm often asked by folks who don't know a lot about 988 what the difference is between 988 versus 211 or 911. So 211 provides information and referrals for local services and resources. Some of the examples include housing and rental assistance, food assistance, disaster information, public transportation, legal referrals, various things within the community that are needed. 911, obviously, we all know, dispatches emergency medical services, fire, police. When you have an emergency situation that requires, somebody's breaking into your house or, there's a fire or an accident, that's when you call 911. But 988 provides crisis counseling and intervention to individuals in the moment that they are the most vulnerable and the most in need because they're in emotional distress. So who administers the Lifeline? This is a sort of a collaboration between SAMHSA at the national level, Vibrant Emotional Health, who for a long time ran the National Suicide Prevention Lifeline, and now the states and the 988 centers. And this is a very interesting partnership. As all things that are a program of this size and scale, there are issues there. But we are, I feel confident that going forward, we're really working to address some of those things, but it is one of the challenges that we have. In particular, because the centers have to take instruction from both Vibrant and the states, but the Vibrant and the states are not interconnected, if that makes sense. So in Florida, we are a no wrong door model, meaning anyone can access behavioral health services at any point. Calling 988 represents a logical entry point into a crisis continuum of care that includes someone to talk to through 988, mobile response teams when you need someone to respond, crisis stabilization units when you need somewhere safe to go, and connections to care coordination and other community behavioral health services. So when it comes to someone to talk to, there are a lot of reasons for people to call. And one of the things that we've noticed over time is that, from some of the studies that SAMHSA has done, is that often people don't think they should call 988 because they don't think that their crisis is important enough. They may not feel like they're suicidal. They may think it's only for folks who are at a place where they want to die. And one of the things that I like to talk about and reiterate is the fact that you don't get to a place where you're suicidal overnight. It's something that happens over time. It's all of the little crises in life that add up to something bigger if you are not addressing your mental well-being. There are also life events that are very traumatic that can throw you into that place. You don't have to be at a place where you are in a suicidal crisis to reach out for help. So some of the things that you can reach out to 988 for: grieving the loss of a loved one, feeling overwhelmed, feeling depressed or suicidal thoughts, obviously, mental illness, emotional trauma, stressful life events. We have just had 2 hurricanes in 2 weeks that were major hurricanes. Economic worries, and also, as well, substance use. So what happens when you call 988? This is a complicated thing, but we've tried to make this slide very uncomplicated. When you call, you're going to get an automated prompt asking you to do certain, choose certain things. It's not ideal, but it does allow you, if you would like to go to one of the national sub-network lines that specializes in a specific thing, to press a number for you to be able to do that. If you want to stay in Florida, at any point in time, you can press 0, and it will route you to your Florida centers. That doesn't always promise that you'll get a Florida center, but right now, 82% of the time you do. First, that call is going to go to an in-state primary center. If that center can't answer within a certain amount of seconds, it goes to the in-state backup center. If they can't answer within a certain amount of seconds, it goes to the national backup. At the point that it gets to the national backup, every single call is answered. 100% of calls are answered. So once the crisis counselor answers the phone, their first step is to assess your safety. Once they have determined that you're safe, they'll employ a variety of strategies to help the caller in the manner that's appropriate to their situation. This can include de-escalation, talking to them about coping strategies, doing motivational interviewing, which allows them to take part in their own problem solving and positive behavioral changes. If at any point in time it is determined that this person needs an in-person response, at that point in time they will refer to a mobile response team. And that's important because a lot of people are worried about calling 988 because they think that law enforcement will be dispatched immediately. And that's not really the case. So here in Florida, the protocol is to do whatever you can to get that person the help they need in a manner that is the least invasive. So yes, there are about, and I'm looking at Javi because he knows this number exactly, but there are about 2%, less than 2% of calls that do go to emergency, EMS or law enforcement or that kind of thing. But those are active suicides in progress. And those are after strict protocols have been employed to try to get that person de-escalated and safe before they take that step. So we can't say that they're never called, but it is a very, very small percentage of the time. So this sort of goes into a little more detail here. There are 3 basic things that you can categorize a call. So you've got active suicide in progress. When that happens, the crisis counselor will request immediate emergency dispatch under certain circumstances if they have followed the protocols and they cannot get the person into a situation where they feel like they are safe. Then you have people who are not suicidal, but they're in acute crisis. So these are the callers that, if they cannot be de-escalated, tend to go to the mobile response units. And then you have non-acute crises, which are the people that I was talking about who are having the smaller life crises that are not suicidal in nature, and they're not necessarily acute, but they've just had some really bad days, right? So at this point in time, they're developing safety plans, they're assisting with coping strategies, they're conducting the motivational interviewing, they are trying to determine if the caller can be de-escalated and moved on, or if they also need some behavioral health services in the community that are non-acute. We bill 988 as a free and confidential service. You never have to give your information to them. However, with caller consent, counselors can also schedule and perform follow-up wellness check-ins for as long as that person needs them. What does the data tell us? So in 2023, the Florida Youth Survey, which is usually a substance use survey, but a few years ago, the CDC's YRBS Youth Surveillance Survey no longer was given in Florida. And so one of the things that we wanted to do to make sure that we were keeping up with some of the questions from that related to suicide and self-harm was we moved some of those questions over to the Florida Youth Survey. And what we found from that was that about a little over 30% of youth reported feeling sad or hopeless for 2 or more weeks in a row. And that's not a good thing, of course, but the positive about this is that if you look from 2021, which is the yellow, to 2023, which is the blue, all of these metrics are going down. So while it's not a great number, we are improving that number. So we also know that about 14% seriously considered attempting suicide, about 12% made a suicide plan, and about 8% had one or more suicide attempts. And that survey is based on 9,101 students from 70 middle schools and 64 high schools around the state of Florida. This is my favorite slide, or one of them. So, what we know in terms of what the data is telling us is that the 988 Lifeline is making a difference for people in crisis. In state fiscal year 23-24, we answered 120,318 calls. We referred 3,428 people to MRT, scheduled over 13,000 follow-ups, referred 62,168 people to non-acute care in the community. We diverted 96% of callers from a higher level of care. And the thing that we are most proud of at the department is that Florida Centers received 1,454 calls with an active suicide in progress that resulted in the caller making it to the next stage of care alive. And to date, for the lifetime of the 988 Lifeline in Florida, there have been no fatal incidents in the entire time while a caller was on the call with 988. So reasons for calling can be sometimes very complex, and it doesn't always fit neatly into a category. And while our data collection is evolving, we still have not yet gotten to a place where we can measure that complexity. For the things that we can broadly categorize, we know that about 40% of callers have some degree of suicidal thoughts or feelings, but only around 2% of those calls are an active suicide risk. We know that individuals with substance use are calling the line for substance use crisis. About 7% of the calls are primary substance use. Overall, nearly 50% of calls are for non-suicidal mental health concerns. We also know that 47,763 calls from Florida to the 988 Florida Lifeline were veterans because they pressed 1 for the veterans line. So, call volume and in-state answer rate. SAMHSA, in the beginning, really touted the answer rate as a performance measure. It's not the greatest performance measure because there are a whole lot of variables that can affect it that have nothing to do with performance. Some of them are technology-driven. Some of them are changing methodologies as Vibrant is working through how exactly to capture certain things. But as the calls have increased in Florida, our centers have continued to increase the answer rate with the increase in calls. So that really is the performance metric there, is if those calls were staying the same number and you were increasing your in-state answer rate, that's great, that's great. But if you are going from 10,000 calls a month to almost 16,000 calls a month and continuing that upward trend of your in-state answer rate, that is really, really good. So we are very proud of our centers for having been able to do that early on for several factors, one including funding in the beginning. And trying to sort of build capacity with their counselors, hiring and keeping people and dealing with burnout. We had a low answer rate in the beginning. We really did. It was 1 month it was 52%, and that was horrible to have. But I believe, and Javi's right here, I think our last metrics were 82%. So it's getting there. And we are, as you can see there, we're consistently, over time, bringing that up. So how do we compare nationally? Whenever you go out on SAMHSA's website and you look at the in-state answer rates for all states, one of the things you'll notice is that there are all these lovely states over 90%. Pay attention to how many calls they take. When you're trying to compare between states, you have to look at the call volume a state is taking. So of the 5 states that take over 15,000 calls a month, Florida's right there in the middle. We rank 3rd in terms of our answer rate. Of those states that have a 90% answer rate or more, none of them take more than 10,000 calls a month. When you're talking about people who are in particularly suicidal crisis, an active suicide, seconds matter. So the national average speed to answer is 34 seconds, but Florida is 32 seconds. So we are already doing better than the national average. I would like to say, since we're in the Panhandle, we have some centers that answer much faster than that, consistently. And your 988 center in the Panhandle answers a 988 call in 2 seconds. Okay, so the future of 988. Geo-routing. So they have been routing calls by area code. We all live in Florida. We know that that's a problem in Florida, right? Because we have 12 universities, we have 19 military bases, we have 5.5 retirees, over 5.5 million, over 1 million seasonal residents. We have 140 million tourists a year. Not to mention, we are #1 in the country for domestic migration to the state of Florida. And all those people have cell phones, and very rarely, if they're coming from out of the state of Florida, are those Florida area codes. So, geo-routing is going to impact Florida. We don't yet know what that impact is going to be. They began last month with the 3 largest phone carriers doing geo-routing. What that is it's not exact location. It bounces off a cell tower, so it's proximity. So whatever center is the closest in proximity to the cell phone ping that you received, that's where the call will be routed to. It started last month, so we don't know what that looks like yet. And I suspect that the data will also be a little weird because of the hurricanes that we've had. So I don't think that we will really know the true impact here for a couple of months at least. But while I can't go into it at the moment, we are doing things to prepare and making sure that all the folks above our heads understand that it's coming, and that with that, and we'll get to this on the next slide, you gotta increase the funding. Because when you're going from 16,000 calls a month to possibly 20, 25, you got to have more counselors that can answer those phones. Which brings us to the next slide, Florida's investment in 988. So the first year, we had a little bit of money from the American Rescue Plan. We had a little bit of money from a small state and territories grant, $12 million. It was rough. The next year, we were able to increase that to $20 million, $20.5 million. And this year, it is $21.3 million. And the important part on this year is that we are now at a place where about half of that is recurring sustainable funding. And what is non-recurring is a grant that is time limited, but tends to be, so far, they've re-upped it twice in terms of once that grant period ended, they offered states another grant period, and the amounts for that were much higher. So, one of the things that we recognize at the department is that suicide is preventable, and the 988 Florida Lifeline is here day or night. A lot of people don't necessarily believe that anybody cares about their problems. So, one of the things that is important to us when we started thinking about marketing was making sure that people understood that every life has a story, and that story matters. And the next slide, I added at the last minute last night because we found out yesterday that the official 988's Florida Lifeline website went live yesterday morning. So, you guys can go there. It has, in the resources section, a marketing toolkit that allows you to pull down pre-approved marketing from the department to use for posters, flyers, those kinds of things. It has the logo there, all of these wonderful things that we have been missing in Florida for the last 2 years. And we also wanted to make it feel very Florida. So we hope that people appreciate the work that was put into this. The other thing that is not on it yet, but that will be coming, we're working towards having a data dashboard on here as well. So all of the data that you've seen today, you can point and click and find every day. If you have questions or comments now or in the future, you can always talk to me or Javi. Our information is on the screen. And I don't know how much time I have left. Do I have time for questions?
You have probably 5-10 minutes, so if somebody has questions, you raise your hand, I'll come give you the mic, or hold the mic for you if you don't want to touch it. Any questions? A lot of good information, understanding how it actually works. We just think, okay, I'm just going to call, or here, call this number. But when you stop and think about what's happening behind the scenes, right, and just looking at these numbers, okay, the theme today was hope. And this is a good picture of a piece of what hope is. So, what about questions? Wow, okay.
Thank you so much for sharing and for revealing this new logo and website. As each state is really branding their 988 and taking ownership of that and being proud of the work that we're doing. Not to put this into sort of an economic and financial context, but it all comes down to money and having the funding, right?
Right.
So you mentioned the active suicide attempts that have been averted through calls, and ultimately we expect over the longer term to see our suicide rates decreasing in Florida and in specific high-risk counties and things like that. Are there efforts made that you know of to sort of quantify the impact on things like productivity or just emergency room visits and those sorts of things to kind of quantify where the savings are taking place? Are you familiar with that, whether at the federal level, because 988 obviously is a federal initiative,
Right.
or even at the state level?
Javi, can you come up and address some of that?
I was basically saying there are already efforts underway, either at the federal or state level, to look at productivity savings with like ER visits, lost lives, things like that.
Productivity savings, are you talking about financial impact there?
Financial impact is we're saving money by doing. putting
That's,
money here.
unfortunately, that's something that's a little bit off in the distance for us. Yeah. Yeah, I would say that if there is a current gap that we're trying to close, it is that follow-up aspect of it, like what happens after someone calls 988, right? Obviously, they're referred to services in the community, and they go to wherever it is that they're referred to. But sort of following up, recidivism and trying to quantify that number, I think that's like the next frontier for 988, but it's still in its early stages. I mean, this just started in 2022, so it's a really good question, and that is something that's kind of off in the future for us.
Other questions? There's no dumb questions. I know we always say that, but there's really not. Because if it's a question that you have and it's not being answered, this is the opportunity. Yes, I see that. Hopefully I won't trip. Probably.
Oh, I
but
can hear, yeah.
When we do this, though, it's being videoed, so we can put it up.
Great, you didn't tell me that before I volunteered. Okay. So the people that are taking the calls, you refer to them as counselors. Are they, what kind of training do they get, or are they a certain, criteria to be a 988 counselor? And then do they also do, second question, I guess, do they do like formal assessments like Columbia's and things, or not?
They don't, so they work under a clinician. They don't
Okay.
work, they're not licensed themselves usually. But if they find that it's something that needs that clinical sort of side, somebody that does need to do a clinical assessment, they can do that. I mean, they
Okay.
can have somebody do that. A lot of the time, especially if that's generally one of the calls that would be a difficult call. So as part of their protocols, a lot of times they'll have a supervisor listening into that call anyway, which would be somebody that would have sort of that kind of ability to, if they were not the licensed person, to, while the call is happening, behind the scenes, they're getting the licensed person, to get on. They do receive training. There are mandatory trainings that they have to take whenever they start working there. Most of those trainings come through Vibrant because Vibrant accredits, and Vibrant has, this is one of the issues that I was mentioning before. Vibrant has kind of set up its own policy, and part of the sort of weird rift right now is that states, especially a state like Florida, that's, third largest state in the country, we already have a crisis system that this is being added to, right? And that crisis system may need a tweak here or there, but in general, we have statutes, state statutes around it and rules and things around it, and not every state is the same. And so now Vibrant is trying to create that as well. And I understand why. It's because there are states, and this is a little unbelievable to me, but there were actually quite a few states that don't have mobile response. I was shocked to learn some that didn't have crisis stabilization at all. And so what they've done is they have decided to create what a crisis system should look like and policy around that at Vibrant. But they've done it sort of nationally rather than focus on the states that needed it. And so that's a little bit of the rub, is that there's a little bit of difference between what we would expect and what they would expect. Also, though, we are supplementing some of the training as well. So one of the trainings that's currently in progress is a training around talking to individuals who may be on the spectrum, who may have some sort of other developmental type disability, because they have a difficult time sort of reading cues, especially if you're on a call. So Dr. Jack Scott at Florida Atlantic University, he has done a lot of research on this, and so he is working with our training folks in our office to develop a training that will be a mandatory training for every single 988 counselor to take in interacting with those people on that call.
That's great, thank you.
And I should say, that reminds me.
Good question.
That reminds me that I didn't mention this, but texts and chats are handled by the national subnetwork. They're not handled here. So when we start talking about local call centers and having local call centers, if it is a call, then it comes locally. If it is a chat or text, that subnetwork, you may get a Florida center. We do have a Florida center that does text, I believe, not chat. They may have changed since then. Hobby can say that. But so they may get a Florida center, but for the most part, it's centers around the country and one or two in each state that are handling those. So I just want y'all to be clear on that, because that's why, for instance, on our website and things like that, we're focusing on the calls, because those are the things that we have control over.
Any other questions? Okay. Nikki, thank you.
Yes, absolutely.
It's so good to have you.
I am honored that you guys asked for us to do this.
Thank you very much. Okay, so what we have next, there's a break coming in a minute, but I have been at functions like this where the vendors, they sit out at their tables. Sometimes you hear about them, sometimes you don't. Sometimes you don't have time to stop and necessarily talk to them. So what we're going to do, we're going to get sorry, vendors, but we got a timer going up on the screen. Okay? A challenge. You have 1 minute to highlight who you are and why you're here and what you do. So we can step over here so you can see him. All right.
Are we ready?
You're ready.
I'm on the clock. Okay. Hi, everyone. Thank you for being here today. I know I didn't invite you, but thank you for FSU for putting on this wonderful event. My name is Morgan, and I am here on behalf of Perry & Young Law Firm. We say we are the injury firm, but we are more than just injury. We are here for you, and we are here for the community. If anyone you know is looking for something, questions, advice, guidance, please feel free to call us. You can Google us, or you can stop by and see me and Kate outside, but we cover the entire Northwest Florida area, and we are very happy to speak with all of you. And usually I'm the one answering the phone, so I would love to hear your voice again, honestly. We usually do injury, like I said, but we also do things like medical malpractice, and we also do animal attacks, product liability, eminent domain. Anything you can think of, one of our attorneys has a hand in it, and we would be more than happy to hear you out and see what kind of rights you have as well. And that's it. Thank you so much for listening to me yap.
Wow, that's it. She made the timer too. All right, thank you. Next.
Hey guys, I'm Michelle Smallwood with your local Gulf Coast LGBTQ Center here. Our brick and mortar is located in Bay County, but we cover 17 counties in the Panhandle because between Tallahassee and Pensacola, we are literally the only brick and mortar safe space for LGBTQ plus persons. I know, everybody's jaw just dropped. So we have lots of programming. I'll keep it short. If you want to know days and times, ask me, but otherwise we have a youth group, a trans group, a family and ally support group. We have a monthly potluck. We have all kinds of good stuff that we're doing for the LGBTQ community, and we recently received grant funding from the St. Joe Community Foundation. We have a Mental Health Matters program, and we can refer and pay for therapy and counseling services for LGBTQ plus persons. So I've got flyers and information. If you would like more, please stop by and see me because I was very limited here, and I'm going to stop here so I can give them my extra 8 seconds.
Wow. I'm worried about her hyperventilating is what I'm worried about.
No breath.
Next.
Hi, I'm Jen Richardson. I am with CARE, which is Chemical Addiction Recovery Efforts. We offer residential outpatient and detox services for those that struggle with addictions. We cover the 6 counties in the area. Our clientele, we work with students ages 12 and up and adults. And we have outpatient facilities in each of the 6 counties, and then our residential facilities is we've got our men's residential facility in Bay County, and our women's residential is just over the county border in Jackson County. And people can self-refer. They can show up to our detox facility, and they will tell them everything that they need to do. And if we don't have room for them in one of our facilities, we'll help find room for them. Thank you.
Thank you.
Hi there.
Hi.
Gonna wait for my minute.
Oh, you're going to wait.
Hey, y'all. I'm Marcia Kroom with the Gulf Coast Sexual Assault Program, which is a program under the Gulf Coast Children's Advocacy Center. We are a twofold program. We are the Rape Crisis Center in Bay, Gulf, Washington, Holmes, Jackson, Calhoun. I think that's all 6. So if you're assaulted, we're the go-to. We provide victim advocacy, and we have a sexual assault nurse examiner on staff who can do the exam in our office or in the hospital. 5 days, you have 5 days. That's the new, it used to be 72, it's 5 days now. We also offer free trauma therapy for adults abused as children or adults abused as adults and need to work through something. All of our services at the CAC and our sexual assault program are free, they cost no money. If you need to refer, come to my table. Everything has our hotline number on it. And if you need training on child maltreatment, on trauma, on human trafficking, if you want one of our pull tab posters for your bathroom, please come see me. I have it all here with me. Thank you.
Wow.
Thank you. Good morning. My name is Patty Smith. I'm with Go Christian Magazine. We are a quarterly faith-based publication, and we love to fill our magazine up with faith testimonies from people who are seemingly in very hopeless situations in life and how a relationship with God has changed their life and changed their situation. I brought many magazines with me today, so feel free to come by the table and pick them up. They're always free. If you see them in a doctor's office or where you get your nails done, where you get your hair done, where you get your car worked on, I mean, feel free to take it. If you are reading an article and you think it might encourage someone else, one of your neighbors or family members, that's what it's for. We put it out in the community at no cost. Our advertisers pay for everything we do. And did I say we go from Apalachicola to Miramar Beach and up into Mariana and Defuniak Springs and anywhere we can, just to bring people the hope of Christ.
Thank you. Next.
I'll wait for my minute. Hey everybody, my name is Alexis Balbuena. I'm the community health educator at PanCare. So if you've never heard of PanCare, we're basically a one-stop shop for all things health. You can come see us and receive your primary care, your dental, your vision, dental, I think I said that, and behavioral health all under one roof. We accept most insurances, and if you don't have insurance, we have individuals who can link you with that as well. I'm part of the behavioral health outreach team, so we have our core programs that provide case management services, medication-assisted treatment, so Suboxone, all those good things, to individuals with substance use disorder, opioid use disorder in the rural counties. I also do free community training such as QPR, I'll be doing that this afternoon, and Narcan trainings, and we give away free Narcan as well. And also our core programs are in Bay and Gulf. Okay, thank y'all. Y'all come see me for more information.
Now, she mentioned QPR. I think there are some slots still open for QPR if you're interested in that. Okay, and that'll start at 1:30. And free lunch for those QPR people.
Hey, everybody. I spoke to you a little bit about the suicide prevention work that I do here in this area. I also want to mention that I do provide free training. I sit down and look at organizations in terms of what they're already doing for suicide prevention and how we can increase that, and through training, through capacity, through different opportunities as well. Really, not just for veterans, really. If we create a better system in our community for veterans and for everybody, then everyone benefits. So it's not just with one population specifically. But in addition, if you didn't know, the VA is the largest healthcare system in the country. We're the largest provider of geriatric healthcare in the country, obviously for veterans and those who are eligible for that. I always say I'm not all things VA, but if I can be a link to helping someone figure out how to apply for their disability claim or apply for VA healthcare, and in particular, particularly, many folks often feel like they don't want to take it away from someone else, but I also look at it as you're leaving resources and you're leaving money on the table. If you're eligible, you've earned it, it's your right, you take advantage of it. So you can come talk to me, I got lots of information out there.
I hear the buzzer. It's very nice buzzer.
Good morning, my name is Tamara. I work on the Florida Veteran Support Line. Nikki briefed what 211 does. We're an extension of 211. We have the same resources and referrals that are available, but for veterans, we could do a little bit extra, and we have charities that help out veterans for financial assistance. I've even done something where I've called a whole bunch of different marriage counselors, got information, and then gave that to the vets. So that's just something extra that we do. We also do take crisis calls from vets. We do refer them to 988, but sometimes we have our vets that just want to talk to another vet on the phone.
Thank you. Next. Oh, wait, let me get to the, oh, wait, restart that. We don't want her to lose seconds.
Hi there, everybody. I'm Shannon. With PanCare as well. I just wanted to give you some more information about our RCOR, which is the Rural Community Opioid Response Programs, which is the mobile clinics that go into the rural communities to provide medication-assisted treatment, which Alexis did talk about. But we go into Calhoun, Gulf, Jackson, Washington, Liberty counties. And also we have the CORE program, which is the Community Opioid Response, and that is for Bay and Gulf County, and that is medication-assisted treatment for people who have maybe experienced overdose and have gone, getting connected through EMS, and then they're referred to PanCare for 24/7 access care. So I just wanted to elaborate on those mobile clinic programs that we have, and we have a lot more information at our table, so thank you so much.
Thank you. Next.
Thank you. Good morning. I'm Denise Montford. I'm the Executive Director for Angel House Bereavement Center. We provide clinical grief counseling to children, adolescents, and adults who have experienced any type of loss related to death, life transition, or change. We do not take insurance. We have a very generous sliding scale. We work with people if they're not able to pay, so we don't turn anybody away. Please stop by our table and get more information. We have a Healing Through the Holidays program that's coming up in November. It's free. We're located here in Panama City on Grace Avenue, so stop by and get a brochure. Thank you.
Thank you.
Hi, my name is Matt Standish. I'm with the Bay County Vet Center, an office of the VA, federally funded, but we're really special because our service is basically a counseling service, primarily for PTSD, but we are open not just to veterans, but National Guard, reserves, active duty members, and we are the only office in the VA that regularly sees family members as well. Because, you know, PTSD is terrible to families. It's a nationwide service. We have them in every state across the country and even our territories. Our big thing about vet centers is we are so independent from all the rest of the VA that anybody who goes to a vet center, nobody will ever know, okay? Not even the VA. It's super confidential. I like to say we are one small step below chaplains. I got plenty of information out in the lobby area, so come by and see me. I'm already having a great day because I already found somebody who needs our help, so I'm good.
Thank you. Okay, it's supposed to be confidential, so he wasn't talking about you. No. No, okay.
I'm not a veteran. Hi, everyone. I'm Christina Williams with Life Management Center, and we provide behavioral health here in the 6 counties, Bay, Gulf, Holmes, Washington, Jackson, and Calhoun. And we have outpatient services for both adults and children for the counseling and therapy services, as well as psychiatry. And then we also have quite a few specialty teams in our under our umbrella. We have our EPIC program, which is early, and that's them over here, for early psychosis. We have the mobile response team. Quite a few of you are probably familiar with that resource here in the community, who is available to come and provide crisis intervention on site when someone is having a mental health crisis. We have our emergency services, so I know there's the 988 number, but we also have a local resource here as well with Life Management Center, so we have emergency screeners available 24/7, as well as inpatient. So let me know if you have any questions. We have a table out here, and my minute's up.
Nice.
How you doing? I'm Joey Sumter, the community liaison. This is Christina Graves. She's the veteran liaison at Emerald Coast Behavioral Hospital. We have an 86-bed inpatient facility located at 1940 Harrison Avenue. It contains units for civilian adults, veterans, active military, as well as adolescents. We help people, military and veterans across the globe and civilians across the state. We have 4 outpatient facilities, one right next to our inpatient facility, one in Pensacola, one at Fort Walton Beach, and one in Mariana. And the great part is, if you're not located in any of those areas, Mariana and our one in Panama City both take virtual clients. They have our IOP and PHP programs. We also provide TMS services at our inpatient facility. A lot more information at our table, so come by, ask any questions that you may have.
So next time I might give you like 2 minutes because I wish I had his voice. It's just got that, you know. Thank you.
Hi, good morning. My name is Marianne Roberts, and I am the Community Relations Director for NWF Health Network. And we are the lead agency for child protection and the managing entity for behavioral health in 18 counties across Northwest Florida. So we do so much that I could not talk about in just 1 minute. But one of the major things that I really wanted to share, because we are here at the Suicide Summit, is our behavioral health resource pocket guides. So if you have not stopped by my table to gather these pocket guides, they have so many incredible things. MRT, like Christina was just talking about, it's got the 988 hotline. We've got TESS, which is a text line for students to text when they're feeling stressed out or anxious, and it texts back with them these coping mechanisms for mental health. We have our provider matrix, which has all of the providers that we fund and the programs like EPIC that they talked about, all of these things with Life Management Center, CARE, and these other programs. So this has a Narcan locator, and it has NWF Health Connects, which if you have not heard, oh, I'm sorry, I'm so done. Connects has all of these resources that you guys are hearing about here and more. So please stop by my table and gather these cards.
Thank you. It's okay. It's okay.
Hello, my name is Anne Marie Curry, and I'm on the board for American Foundation for Suicide Prevention. And AFSP is we are great at, I'm sorry. I knew I was going to do this. It's okay. So, AFSP, it brings hope to those affected by suicide, and we also provide resources. We have just started where we are going into schools, and we are able to, for students and and it can be starting from elementary, middle school, high school, and college students, and we're able to go in and teach them how to look for the warning signs, for maybe if their friend is experiencing some type of crisis, and they're able to get help for them. And we also have many other options. You can come to our table to learn for more.
Thank you. You did good. Chris, dude, I know this guy.
Yes, you do. My name is Chris Hockman. I'm the Senior Outreach Coordinator for Oxford House. Oxford Houses are peer-ran, self-sustaining group recovery homes. As far as locations, we have 12 different houses that service anywhere from men to men with children, women and women with children. We are gender specific. We do not do co-ed. As far as referrals, we work with a number of different community partners and get referrals from a number of different places. And how you can apply to be in an Oxford House, there's a number of ways you can also apply from our national website, which is oxfordhouse.org, to oxfordhousefl.org. If you're interested in learning more about Oxford House, I'll be at the table outside. You can come talk with me. There's a lot of moving parts with Oxford Houses, and I'm happy to talk with you.
Thank you. Next.
Good morning. I'm Ernie Vi. I'm with the Canine Training, Panama City. We're located in Kingswood Road in Southport. But more importantly, I'm a member of the Alliance of Therapy Dogs. The Alliance of Therapy Dog is a nonprofit organization that's internationally recognized for their dogs and taking them places. We're one of the top-rated therapy dog organizations by the American Kennel Club. But our dogs provide a lot of support to local areas. We go to Sibs Veterans Home on a regular basis. We go throughout the school systems and every place. But any place where an ear is needed without judgment is where we take, therapy dogs. So later this morning, we'll give you a little bit more information on that. But we do have a booth out here, and a couple of our team members are here to give more information on therapy dog programs.
Thank you. Now, did we hear from her already? Because
I'm wearing two hats, Mike.
doesn't look like a hat.
I know, it's a headband, it's sparkly. I am also with SPARE. I'm the vice president of SPARE. I'm very proud to be a part of that organization. If you're not familiar with SPARE, it stands for Suicide Prevention, Awareness, Response, and Education. And it is a coalition of volunteers and mental health providers who, our main goal is to provide resources and education on suicide awareness and prevention. We helped support the conference here today. And so please come out and check out our table. We meet the first Thursday of the month. It's open to anyone in the community who has a passion or interest in helping provide resources on suicide awareness. We have our Walk of Hope, Bridge of Hope Walk coming up on October 26th. Our September date was rained out, so we are excited that we have it on the calendar for October 26th at the Bailey Bridge in Lynn Haven, so come out and walk with us for suicide prevention.
Thank you for two hats. Okay, I believe we're going to go ahead and take a break. If you hear somebody walking around telling you it's time for the next thing, so please stand up, go walk outside, enjoy the weather, come back. Thank you. Testing. Testing. So I'm going to go ahead and do a little 5-minute thing here, or maybe 10 minutes. I know we got ahead of schedule. Where do you go someplace and they get ahead of schedule? So kind of crazy. Are you guys, is this helpful to you? I'm going to kind of start this conversation now. Is this a helpful event for you? You can shake your head, wave your hand, do anything like that, okay? One of the things that I'm going to throw out for you to think about is, this year's theme is hope. And so I'd ask you to think about, maybe, I'm sure you already have, okay, but what is hope? Because I think hope envisions a lot of different aspects. I think hope is like a diamond or a gem, whatever you like, whether it's emeralds, rubies, whatever. But I think hope is like a gem. There are different facets to what hope is. Example, when I was, growing up in Colorado, I was thinking, 18? Yeah, what am I hoping for? Okay. And then 21, what am I hoping for? So I think at different points in our life, hope changes, and there's different facets to this idea that is hope. But when we're thinking about the topic and people that feel what? Hopeless? Again, how do we offer them hope? One of the things that I'm kind of processing as we're going through this is, what are they looking for? Because we're talking about it. We're talking about maybe somebody reaching out to them, somebody being aware, okay, of who they are, acknowledging what? Their existence and where they're coming from. So, this idea of hope, again, it's big. And I'm encouraged when I look out here, because there are so many people, because you are hope. You are a facet of hope. You're coming, you're learning, you want to promote awareness. That's one of the biggest things my understanding is, and I think some of the speakers are going to confirm that if they haven't, okay? But is this idea of awareness, and that, look, there are people available. There are services available, that provide hope. And so thank you for coming. Thank you for being a part of that hope, okay, that you're going to be able to offer to those people around you, whether you're professional or just in the community. You don't have to be a mental health professional to offer that hope. It's the idea of, look, I'm here. I'll be glad to listen to you. I'll be glad to acknowledge your value, your self-worth, and try to identify with you and where you're coming from, And it's difficult at times, all the time. So thank you again for coming. And we are going to go ahead and bring up Ernie, and he's going to talk to us about his venue and what he does with the support animals. And we're grateful. Thank you.
Well, again, it's our pleasure to be here this morning, and as I get started, before getting started in the briefing, if you don't mind, I'd like to introduce a couple of folks here that's also part of our Alliance of Therapy Dog Teams. And over here to my left is Dina Allen and Donna Ward. They're both therapy dog team members, and we appreciate all their hard work and effort. As we get into the briefing, I'll tell you a little bit more, but all therapy dog people are volunteers. We do not get paid. We don't charge for taking our dog places or anything else, just so you know. Because I've had people, how much do you charge? Nothing, it's free. All right. So today what we're going to be talking about, what is the difference between therapy dogs, service dogs, and emotional support animals? Or is there any difference? Are they all the same? Are they all treated the same? most of you, because of your profession and everything, you understand there is a difference. But the general public does not understand that, or they totally ignore that, which is actually very dangerous too. The American Disabilities Act actually defines the 3 different categories. They have it outlined what it is and everything else. And then, of course, the Department of Justice, they are the enforcers. There are laws that do regulate therapy dogs, the emotional support animals, and service dogs. Most people don't realize that again, they think, okay, I can take my dog any place I want to go. I don't care what the category is or anything else. And that's what we're going to get into to help educate everyone on that. All right, an emotional support animal is just a pet. All right, they are your pet. However, a true emotional support animal, the owner has a letter from a doctor saying this person needs this dog normally for emotional support. The dog does not have to be trained, nor does it have to, there is no such thing as a certified emotional support dog. They're just emotional support dogs. I hear this category, a lot of people say, okay, my emotional support dog is certified. There is no certifying agency for emotional support dogs, just so you know. But some states do allow emotional support dogs to go any place a service dog goes with permission. Florida does not. Florida says an emotional support dog is a dog that's normally in your home, or if you have the bona fide doctor's letter and have, meet the criteria, you can get a Fair Housing Act waiver where your dog can be with you even though you might be in a facility or like in a condo that doesn't allow dogs, the dogs can come in that case. But you have to have that letter from a doctor to be in order to get that waiver. But again, they don't. It's just a family pet. Now it can be a cat, it can be a dog. In some cases, it's a horse or birds. I've known of people who have birds that are emotional support animals, and that's fine if it makes the people and if it helps them. There's nothing wrong with that, personally. Now, emotional or therapy dogs. Again, they are certified. They're the only dogs of the 3 groups that are certified. And that's because of the nature of their work and where they go. For instance, they're there to help people in various situations. I know we're talking about suicide awareness. We can go into facilities, and we go into facilities where people are recovering and doing different things. The emotional support there is not, the therapy dog, is not judgmental. They don't care what your status is in life. They're there to bring comfort and to help the person relax and everything else. We've seen it in hospitals where where people are waiting to go in for maybe like a heart cath, if you're familiar with that. Their blood pressure drops down, they settle down because of the petting the dog. And a lot of you are in the programs of therapy and everything, you understand how that reduces blood pressure and everything else. So very important work that they do. To be a therapy dog, the dog has to be at least 1 year old. They have to be well trained, they have to be well behaved, and highly socialized. Now, do you have to go through a formal training program to teach your dog that? No. If you can self-train your dog, that is good. But most people do not have the skills to get the dog to the level it needs to be when you're going out. Have any of you ever been in a situation with your dog where there's 100 kids screaming and clapping and going happiness all over the world? We've been there and the dogs just sit there and say, okay, just come pet us. But the average dog can't do that. So it's something we're actually training people as to how to handle their dogs. The owners all have to go through background checks. Now, sometimes we have to go through multiple background checks. For instance, at Bay Medical Center, we had to go through a background check. The public schools, we had to go through a background check. The Veterans Administration, we had to go through a background check. We've had so many background checks, but again, I understand the necessity for that. But just so you know, that's part of the process. They have to have yearly exams, and we go through, to make sure the dogs are still up to speed to do what they are trained to do. And then last but not least, then they have to go through an evaluation process. Not only they have to go to certain facilities, medical facilities to be evaluated and everything else before they can get their certification. And that's where we have certifiers. Donna is a certifier, I'm a certifier. Not every member can certify. It has to be certain people with certain backgrounds that do the certification. Some of our therapy dogs are actually disaster recovery dogs. They can go to disaster scene. The young lady you see here in the picture, she is a member of the Panama City Fire Department. Her and her dog are currently deployed providing therapeutic dog service for the responders as well as for people and everything else. I kind of make the joke growing up, we envisioned Dalmatian dogs being with the fire department. Well, Lucy's a pit bull. So she brings lots of joy. She loves her job. But they can also be a service dog, so they can go both ways. They can be a service dog. However, when a service dog is doing therapy dog work, they cannot have any identification saying that dog is a service dog. And I'll go into the reason for that here in just a few minutes, because it's two separate working categories what they're doing and everything else. And so with that, let's talk about service dogs. Service dogs, now this is the ADA's definition of a service dog. They are working animals, not pets. They're trained to perform tasks associated with a person's disability. Now, that disability, it could be mental. We heard talks about PTSD. We do a lot of training for training dogs for people with PTSD. Because of the military installations here, but other situations, we train a lot for PTSD. It can be someone who is paralyzed. We can train the dog to assist with wheelchairs or even wagons in some cases. So whatever the disability is, it could be just picking up something, the person can't bend over and pick it up, or they can't hear. The dog, okay, they know when someone's knocking, they know when the phone's ringing, they go alert the owner. So, or if they have an autistic child that likes to run away, the child can be tethered to the dog and the dog won't let them run and everything else. So again, it's all tied individually to the disability of the person. Now, the ADA does allow some, in special cases, miniature horses to be a service dog. Well, it's a service animal, but it still carries the title service dog. We have big dogs, and some of us have talked here. You take a Mastiff or a Cane Corso, some of those, or some Great Danes, some of those are as big as a miniature pony. So there's no really, that's why they have allowed those. There is one up in Fountain, an organization that does that work, but they do have a service animal that is a miniature horse. Now, to qualify to be a service dog, the owner has to be treated by their doctor, and the doctor has to provide a letter stating this person has a disability and they need the assistance from this dog to help them out. They also, it's best if you haven't self-trained your dog, is to have some kind of proof that your dog has had training. The reason why this is important is if you're out in public and there's any kind of an incident, you go to court, the two things they're going to ask you, what kind of training your dog has had, and first of all, they're going to ask you, do you have a letter from your doctor? If they don't have either one of them, they're not going to win their case. In fact, they're going to say your dog's not a service dog, because that's an ADA requirement. It's also a state requirement, and every one of the states follow these same requirements. Because if you don't have some guidelines, and you all know this, how do you know what's legitimate and what's not legitimate? Also, again, they have to be highly trained, well socialized, and they have to be task trained specifically and everything. And we'll get more into that. Okay. Now, as far as training the dogs, it can take if you take a puppy, some organizations take puppies, they they will take a puppy and breed them and train them to be service dogs. That can take the process 18 to 24 months, depending on the dog. Not every dog is suited to be a service dog either. If I have a very high drive, high energy dog that just can't calm down, they're not going to really be a good service dog, because you're going into public places. You don't want a dog that if someone had a service dog here, that dog should be off to the side and no one even knows the dog's here. But if you have one that wants to whine and jump and play and everything else, that's distracting, and so that's not going to work out. So that's why they go through a process and select those dogs, which is going to be the best. So also, you see an example up here of some of the things, and I kind of mentioned that, what dogs can be trained to do. This is not the end-all list, but this is the more common ones that you see what dogs are being trained for. Service dogs must be fully trained before they go with their handler. The handler is the person with a disability, or in some cases, if the person's disability is severe enough, they have a person who is assisting them, that a person assisting them can actually be the handler and handle the dog for that person, but the dog still performs some tasks and everything on that. Florida State does allow a trainer to take their dog that they're training to any public place that a therapy dog or a service dog's allowed to train them. Because if you don't take the dog out and train them where they're going to be going, they're not going to understand what they're supposed to do. I've seen dogs that can be trained in the side of a building. They can do all kinds of things, but once you get them out in public areas where there's distractions, they're not conditioned and they're not desensitized to that. So it's important that they be trained in the environment that they're going to be going in. Another thing, if a service dog is out of control, a facility, even though it allows them, can tell the person to leave with the dog. Now that's because you can't have let's say if you're in a class here, you can't have a dog disrupting the class instruction or anything else. That dog should basically be over there in a down, relaxed position and not disturbing what's going on. Also, if something happens to the person, the handler, emergency responders have to be able to approach that dog and take care of the person if they have a medical emergency without fighting them. A couple weeks ago, we had an incident in Bay Medical Center where a person said they had a service dog. The dog was barking, growling, and trying to bite the medical attendants. Luckily, they were able to get the dog calmed down and move it away. And lo and behold, which no doubt to anybody, the dog was not a valid service dog. But you can see the problem that can cause, especially if someone has a heart attack going on. The first responders have to get there. And not to alarm anybody, but just so you know, law enforcement can put a dog down on site if the dog's out of control and it's in a danger to the public. Technically, they can do that to any of us who have dogs, even on your property. If they come there for a legitimate reason and a dog is trying to attack the officer that's responding to something, if it's a life safety thing, they can put a dog down and everything else. So no offense, I'm not here to debate the law. I'm just telling you, this is what the law says. Okay. Service dogs do have legally defined access where they can go, and believe it or not, where they cannot go. And it's probably more important to understand where they cannot go and the reasons why they cannot go certain places. But if it's a legitimate place where the dog is allowed, people cannot refuse that dog. We hear a lot about that. It's mainly a lot of restaurants, a lot of hotels. You come in with your dog and they say, you can't bring a dog in here. I don't care if it's a service dog, military working dog, law enforcement dog, you can't bring it in. Well, the federal law says, and state law says, yes, they can if it's a bona fide therapy. I keep saying therapy dog, a bona fide service dog. And so the Florida laws have very specifics on that and everything else. But the entity can ask questions about that. Now, we all know from HIPAA they cannot ask you what is your disability? That, you cannot ask them that, but you can ask, is this a service dog? Also, you can ask, has this dog been trained to perform tasks associated with your disability? I cannot ask you what your disability is. What I recommend for all the folks we work with, and when we can, carry a copy of the doctor's letter with you, because that can negate a lot of questions and say, I have my letter from the doctor. I also provide a letter of signifying that this dog has been through our training program, that here's the task the dogs have been trained in, without mentioning a disability. A doctor's letter does not say the person has, what their medical diagnosis is. It just says the dog requires that. I've actually asked people to take a letter back to the doctor because they put all the medical history on there. They don't need that medical history. All they need is that bona fide doctor. Now, when I say bona fide doctor, it has to be a doctor that's been treating you. And we'll get into it in a few minutes. People go out on the internet. I can get a letter in about 2 seconds standing here on my phone and sent to my email and said, okay, Dr. Smith over here wherever, it says, my dog's a service dog. Voila, I'm ready to go. That's not legitimate. And you all understand that. So, entities cannot require the dog to demonstrate. If I if someone asks me about, okay, can the dog really pick up stuff for you? Show me. They can't ask me that. They have to take, if I have the credentials and say that's what my dog's trained to do, you do not have to prove that. Again, ADA allows for just about any place the public can go, a dog can go, but there are exceptions. Churches, places of worship, they can restrict a dog. It used to be they couldn't, but they've changed that. And the reason they've changed that, how many of you been to Walmart in the last week? Okay, nobody's been to Walmart in the last week, okay. And the reason I ask that, every time I go into Walmart, I see at least 5 dogs that got a little vest on it running around saying, I'm a service dog, or I'm a therapy dog. I've almost been bit twice by service dogs. No, I think we all understand, but that's why the laws are so critical on that, because when you're passing off your dog as such, not only is it a liability for you, but the dog and the people and the organization. So it's a very thing we have to think about. Commercial airlines can deny or approve a dog to fly. That's up to them because they're under the federal aviation rules. And the reason they do that is because once you're airborne, if something happens up there in the air, you have limited control, and you don't want a vicious dog on an aircraft, running around. What normally happens, now I'm going to tell you my experience. Airlines will contact me, even international, if someone I have trained comes to me and said, hey, did you train this service dog? They're looking for specific criteria that we've been trained by, especially the international, because some of the tests that they want, temperament tests done is a little bit different than what we do here in the States. But we mainly train just everything that a dog can go any place with the fly. But they want a letter signifying that. That way they can come back and validate the fact that, okay, this guy is legitimate and the dog does meet the criteria. They also will ask me, what task is that dog trained to perform? That's very important for the airline. Because if something happens to, let's say we have an owner that has blood sugar and their blood sugar starts dropping. Some dogs might come up and start poking the person real hard and everything else. Somebody said, well, what's wrong? This dog's doing nuts. Well, that's what the dog's been trained to do. And that's a common thing. It used to be a practice where the dogs would come up and jump on the person's chest. They've really stopped that because, number one, if you're out in public or if you're unsteady, a dog jumping on you can knock you down and think, okay, this dog's out of control, and so it's not a very good situation. So, but the airline needs to know what that dog is trained to do. Maybe it's to pick up a dropped article. Some people may have to take some medication. What if they drop it and it starts rolling down the aisle? Well, then the dog knows to get that and bring it back to the owner. But the airlines, again, you can understand, has to know that. So they don't say, hey, we have a situation here where a dog's out of control. Even if you have a legitimate service dog and your dog gets out of control in that organization, like we said, like if they disrupt a class or if they're disrupting a presentation or something like that, the entity can tell the person, leave with your dog, and that is legal. People have argued that. That's my service dog, they're gonna stay with me. If it's causing a problem, the dog, really, the training needs to be worked on that case. Now, I've alluded to this, but let's go over this a little bit. The ADA does not require a service dog to be certified, nor is there any such thing. I've had people call me all the time and say, I have a certified service dog. Okay, that's a red flag number one. I know where you got your certification from. But there is no such thing as a certified service dog. Keep that in mind. Some of them issue ID. This is actually an ID card you see that was issued to a local dog here. They actually, if you look at it, they said the dog is a therapy dog and it's also a service dog. No, going back, therapy dogs have to go through a certification process, and that organization has their own special identifier to say this dog, and it will not look like this. Some of them do have pictures, but like this one has a little tab like a credit card. What somebody did, they pay about $50 a month to give them this organization all their personal information, and it has nothing to do with anything, because they say, well, your dog is registered for what? Just because you go someplace does not mean that your dog, is going to be declared. That's why the ADA does not require that, nor does the states do not recognize that. An organization, if someone's dog causes a scene and and it goes to court, that organization could be held liable for fraudulent participation, because that is not legal to do that. Also, if they filled out a voucher for the Fair Housing Act to get someone in a house, they can be prosecuted for that under Florida law and under federal law. They're starting to really crack down on that. The provider themselves, who actually put their name on that letter, can be under criminal penalty. There are actually some physicians here in town who have just signed off people's papers without even knowing anything about the dog or anything else, and the legitimacy of it, because they felt, well, this might help the person. So there are some liabilities to all this stuff. And it needs to be, because those who truly need a service dog or have one, they need the protection where it's not a fake dog. Many of you might have heard, again, this is all recent events. A service dog was actually attacked on two different dates at different places locally from dogs jumping on them that was supposed to be a service dog, but yet they weren't. The service dog just laid down and took it, and the owner got him out of there. So, but this shouldn't be happening, because these people need these service dogs. And all it does, it makes the situation, especially someone with PTSD or some other, a lot of anxiety or something, that just makes the anxiety worse. And that makes them more medically vulnerable, for problems to come up. So here's the references for this. Real quickly, and we have some paperwork out here. You can get more detailed information. I'm going to real quickly run through what we do to train them. We have a confidence building course that we take the dogs through. The more confident the dog is, and the more confident you are working with your dog doing this stuff, the better the dog's going to react. Some of the obstacles you see, Lucy down here in the little corner, that's a 12-foot swinging tunnel. The thing just swings all over the place. What that is, that helps with motor skills, but let's say they're on a boat, they're on in an elevator, moving sidewalk, that helps them decondition for that. Going up and down steps, over the teeter-totter. Now, you see these people in the competitions where the teeter-totter's going down there, but that's scary, because when that hits the ground, it vibrates and makes noise, and so the dog learns to walk over that. We train, personally, the people with their dogs. If I train a dog, I can have it doing anything. But when you go home with the dog, if you haven't experienced the dog and what they're supposed to be doing, or if they're distracted, it's going to make you harder to control your dog. We do go to public places. We set up all kinds of situations. You see a picture with a boy there with a walker. You can't see his face. He's got a Halloween mask on and he's going about. But we do this on purpose. We want these dogs to be very desensitized for what they're being trained to do. Therapy dogs, actually all of our dogs go through it, but specifically our therapy dogs are going through training, our service dogs are going through this training. A lot of public places. The picture in the top middle, that's the Lynn Haven Animal Shelter. We go right up there and the dogs are jumping and they're barking and they're having a good time wanting to play with our dog. Our dogs do a downstay, we walk away. So you can get an idea of what the training entails. Going to public places, we go to airports, sporting events, parades. The bottom picture over here to my left, that's an antique shop. If you've ever been in an antique shop, the smells are overwhelming. A dog's nose is 100% more picks up on smells than ours. So you just imagine what that dog's going through. But again, that's part of training them. Well, you can take the dog any place. We go to hospitals, we train. We go elevators. The black dog you see there, that's a 160-pound cane corso. He's on the elevator with another dog in the back and everything else. But he's a service dog. He's a therapy dog. So he has to be trained to be able to go through this regimen. And that's what you want too. And just as a real quick summary is emotional support dogs are pets. They have to have a doctor's letter to be legitimate, but they cannot go any place a service dog goes. They're normally for homebound. Therapy dogs are highly certified. They have special requirements. They have to be certified by their parent organization, but they're there to go out into public places. We go to nursing homes. We go to hospitals. We go to schools, private individuals sometimes. And then service dogs are working animals, again, that are highly trained to be going out into public places and to help with the person's disabilities. Any questions? Is it Mike? Can I?
Questions? Does the mic work? That's the question. There we go. Any questions? Here we go.
Why can't the ADA make it a requirement that service dogs and therapy dogs be registered? That way there is a card that the person can carry, a legitimate registration.
That's a debate that goes on all the time for service dog. There would be a benefit to that, so you can, make sure it's legitimate. Part of the problems or the concerns is who would be the certifying registry agency? Would it just be anybody? But to me, that's something that could be done. But I think there could be a benefit to that, along with shutting down some of these websites that offer all this. People don't understand what they're doing a lot of times, that they're breaking the law. Right.
Coming up, and your poor dog is doing its job.
You're right. Now, and that's a good point. Now, when we're doing our training, we practice those scenarios to show the owner what to do in those situations. However, you have an owner in a wheelchair, or depending on the disability, they may not be able to react. Our therapy dog people, though, normally they're able to take evasive steps to do that. But your point is well taken, and I agree. I think there's something that could be a national registry could be set up. And that's something a lot of you have contacts at, at higher areas within government, and it's worthwhile. I think it's worthwhile pursuing.
Yeah. Thank you. Good question.
What are the credentials to become somebody who's a certified dog as a service dog?
Okay, to become the credentials are, number one, basically, you have to make sure the dog's well trained. You have to have that doctor's letter saying that. Oh, people who certify the dog. There is no specific credentialing. There was a movement about to have only certain organizations do the training. The downside of that is they're going to monopolize, and their techniques are different. What I suggest you look for, look at the organizations, what they're training. We do not use shock collars, we do not use prong collars, we do not use choke chain. Those devices cause more problems to the dogs. There's actually here locally dogs that had to have those surgically removed because they hurt the dog. I've had to rehabilitate dogs that have been shocked too much because it doesn't work. You need to use positive reinforcement. I would suggest checking the person's background, see if they've had a formal school training or if they've learned on the job and how they've done. I was fortunate, I did go to a formal school for both training and for dog behavior as part of the zoology. I was in the military, so I had a good background. Not all of them do. A lot of them anymore, they want to take a shocker and go shock, 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 get in line and do it. That's not the way you train a dog. But it's a point well taken. Also, word of mouth. Ask people, how does your dog, and go out and watch him. I've had people say, can I come and watch you train, see how you do it? Sure, come. If somebody tells you, no, you can't do that, I would personally, I would avoid them. Donna, Dina, have anything you might want to add to that?
I guess one thing I would add is there's no actual certification, because certification is a very specific word.
Yeah.
You just need the doctor's note, and your dog is sealed before and asks you go in there for service.
Yeah, for the service animal, yeah. Yeah. And anytime, if anyone ever needs assistance with that, we provide free assistance to help people get that. The more we can educate the public and get what they need, it's going to make it better all the way around.
I know I found it interesting because being the therapist on campus here and the dorm being over here, I always have a student or two that will call and say, hey, can you sign this form? And I'm like, no, I can't, But they end up getting it signed they'll go online and pay $35, $40 and present that. So
Yeah, I've had some schools and colleges contact me and say, can you validate that this dog has been trained? And again, they're looking for certain credentials and everything else. So.
Other questions? Okay. Wow, everybody's explaining really well today.
Good.
So,
and we have handouts of today's briefing with more detailed information out here at the point. So feel free to come and get those handouts and everything else.
okay. Thank you so much.
Well, thank you for the opportunity to come
I
here.
appreciate that. Thank you. We're going to take about 4 or 5 minutes, get the keynote hooked up with their mic, and then we'll get to the next part. Thank you.
Good morning. Thank you all for coming. My name is Pam Perry, and I serve on the planning committee for this seminar, and we appreciate your participation. And I have the pleasure today of introducing our keynote speaker, Dr. Scott Poland. He's a professor and director of the Suicide and Violence Prevention Office at NSU, Florida, in Fort Lauderdale. He is internationally known for his work on suicide prevention and school crisis. His 8th book is coming out soon. He has received many awards, including the Houston Wage Peace Award, being named the most outstanding psychologist in Texas, and he also received the Helping Parkland Hill Award. Please join me in welcoming Dr. Scott Poland.
Thank you very much, Pam. Thank all of you for being here today. And I believe you are shining a bright light on suicide prevention in your area. And you know, when I was listening to the presentations today, Lauren, you talked so much about resiliency and about hope and about reaching out. You know, what are the keys to resiliency? They're being surrounded by loving and caring family and friends, having problem-solving skills, being optimistic about the future. Those are the keys to resiliency, and having the opportunity to vent strong emotions. And Nikki, you talked about 988 today, and I was really excited, first of all, to learn more how it works, but the data and the fact that with some patients, 100% of the calls get answered, and that was some really good data from our state. And I'm going to talk a little bit about pets and their importance in just a moment. And, you know, we lived at Hollywood Beach. We lived in a condo building for 7 years. It had 240 units. And how many friends do you think we really made in a condo building in 7 years? 1. And, you know, the CDC has said the biggest thing about suicide prevention is connections. And this conference is connecting people from all walks of life. But we did get to know the security guard. His name was Bob. And Bob wasn't like our friend. I mean, we never had a meal with Bob, but we had 2 little dogs, and Bob came to work at 11 o'clock every night, and we saw him every night. And Bob loved flirting with my wife. That was okay with me. And we would see Bob every morning before he left at 7 in the morning. I'm really sorry to tell you that Bob fell away from work. He was an old guy, about my age. He broke his hip. He wanted to go back to work. He could not, because the condo board said, we can't have a night watchman and a walker. And you know, we tried reaching out to Bob. We wanted to take him some food, but he finally said he was embarrassed about where he lived. He lived in one of those motels that rent by a week. He didn't want anybody to come visit him. And he loved dogs. And I've just always thought, if Bob could have had a dog, he'd probably still be with us. My wife was trying to connect him with Broward 211, and we learned that, unfortunately, all he had to live on was $1,000 a month in Social Security. The Miami area is one of the most expensive places to live in the United States. Bob's quality of life just wasn't very good. On one call I had with him, I'll never forget what he said to me. Scott, I wish I could live on your balcony. I didn't get it. The desperation that Bob was experiencing. We had no idea he even owned a gun until after we learned that he shot himself. Now, right now, if everybody would just take a moment and have your own thoughts and or prayers for all those people in Florida impacted by hurricanes. And I think you all know who would be the most likely to recover. That would be someone like Bob, trying to live on $1,100 a month, and they lose their home or their trailer. And I truly hope that our state and nation really steps forward to help them. And by the way, I respond to every email I ever receive. I mean, okay, I'm sure I missed some, but never on purpose. If I can help you in some way, do not hesitate to contact me. Now, everybody else was able to basically operate this correctly. And obviously, I am not being able to do that. And Michael, And by the way, it's been said that Michael and I look a lot alike, but don't you think I'm really better looking? Okay, what button am I not pushing here? Okay. All right, thank you. All right, so unfortunately, suicide rates in America are near an all-time high, more than 49,000. By the way, do you know what our Surgeon General said? We got to talk about suicide prevention more in our homes, our schools, the places of worship, and in the workplace. There are a number of groups that are particularly at risk. Young people. Sadly, it's the second leading cause of death for middle schoolers nationwide. It is the third leading cause of death for high school students. We're very concerned about suicide with the military, our active duty, as well as our veterans, and we're very concerned about suicide for elderly individuals as well. And the rate has gone up for 8 to 12-year-olds. I'm sorry to tell you, in my work in the schools in Texas, I had to respond to the suicides of 9-year-old students. But if you want the most accurate information, go to Suicide Awareness Voices in Education. Now, I lost my dad to suicide 50 years ago last week. I was very aware of that when I was speaking in California last week. And I'm a good example of somebody that never thought it could happen in my family. If you lost a loved one to suicide, I have a pretty good idea of what you've gone through. And by the way, most suicide prevention in this country is actually driven by survivors like myself. And I still remember that last conversation I had with my father. I just didn't know the warning signs. I just didn't get it. And you know, I'd give anything to just have that conversation back. I should have just asked directly, are you thinking of killing yourself? Is that it? And at least I would have had a chance to stay with him and get him the help that he needed. Frankly, he was a Marine that fought in the South Pacific in World War II, and he really didn't recover. He had a lifelong problem with PTSD, alcoholism, and depression. And he died at age 53. He should have been here for many more years. One more personal example. I have a rich brother. Does anybody have, a rich older brother or sister? And by the way, we differ a lot. And for my brother, it's all about what can he own. He actually owns 3 beautiful homes and so many boats I almost can't count them. He's got boats in every one of those 3 places. For me, it's more about what can I experience. And the most recent trip that was memorable, we went to Antarctica. I mean, it's a big world out there. We got to get out and see that world. But my brother is a Florida snowboard. By the way, his lavish condo is on Marco Island. Have you been to Marco Island? But Marco Island is like perfect, okay? And my brother jokes about what he calls Marco Midnight. It's about 9 o'clock. Everything's closed. Everybody is now safely in their homes. But he called me last winter, and he was very upset. I said, Steve, what is it? He says, my neighbor Brian was seen in the parking lot of the condo building yesterday holding a gun to his head. Well, I asked the most obvious question. Did somebody rush Brian to the hospital, to the emergency room? No, they didn't. Well, do you know, does he still have his gun available to him? Yes, as a matter of fact, he does. I asked his wife about it. She said I couldn't possibly take away my husband's gun. And then my own brother said, Scott, what difference would that make? Steve, it would probably make all the difference in the world. There's a website at Harvard called meansmatter.com. You raise the barrier on the bridge. You locked up the pesticides. You secure the guns. Suicide rates go down all around the world. I asked a little bit more about Brian. I found out that Brian was being treated for Parkinson's. Well, Steve, I have a theory. I bet he's being treated for Parkinson's, not for the accompanying depression. I'm really proud of my brother. He actually went with Brian to the doctor. Brian told his physician about his suicidal behavior. Brian is getting treatment for depression now as well. By the way, there's evidence-based treatments for all forms of mental illness. Brian is still with us today. You know, now that I mentioned guns, I want to be very clear. I'm not here to question any adult's right to own a gun. I'm simply going to say, when you have a troubled, angry, depressed, substance abusing, or maybe even mentally ill person in your home, that's when those guns need to be secured. I have personally responded on site to 17 different school shootings. Do you know what we're missing? The idea that if a kid can't get access to a gun, then they could not shoot anybody at school. Why isn't that a national mantra? It doesn't have anything to do with ownership. It has to do with responsibility. So most of the time, yes, there was untreated or undertreated mental illness, but not always. Many times they're just adverse life experiences and quality of life issues. So I talked quite a bit in the beginning about Bob. Obviously, I mean, it's not like I knew him extremely well, but I don't think he had any form of mental illness. He just didn't see a quality of life that was worth living. There's actually a guy by the name of Craig Bryan. He wrote a book on rethinking suicide, all about trying to improve the quality of life for all Americans. So what is the most common precipitating event to a suicide? Well, if it was an adolescent, I would say probably severe argument with parents, breakup of a relationship, maybe about to be kicked out of school, dramatic humiliation, maybe online with lots of kids joining on and increasing the humiliation. But for adults, it very likely could be the end of relationship, a financial problem, about to be fired from their job. And think of it as like the straw that broke the camel's back. They've been thinking about suicide for a long time, but something happened that caused them to take action. And then I did a little research quickly on what do we know about natural disasters and suicide rates. Unfortunately, suicide rates go up. Study of the earthquake in Japan, it went up. Study of Hurricane Katrina in the United States, it went up. Study of the tsunami in Southeast Asia, it went up. And anecdotally, some of you have told me you feel like suicide rates went up here in the aftermath of Hurricane Michael. Good news, National Strategy for Suicide Prevention. And I'll talk about that a little more in a few moments. Thankfully, Nikki told us quite a lot about the suicidal behavior of high school students right here in Florida, and we have data nationwide as well. You know what my greatest hope would be? That every kid, before they graduate from high school, would learn how to help themselves, how to help their friends, don't keep a secret, get an adult involved. And you know what I like to say to students? You might need this information next week with a high school friend. You might need it a couple years from now with a college roommate. You might need it on the first job. You might need it when you have an elderly neighbor. If just everybody knew what to look for and what to do. And, you know, I want to thank Perry and Young. I know they're a very big sponsor of this conference. And I was talking to Larry last night, and he was asking if I'd been involved in any legal cases, and I said yes. Over the last 30 years, I've been involved in about 35 cases. And what can I tell you quickly? Well, first of all, often a suicidal individual denies being suicidal. But if you're working in a school, and I met some great ladies that work in Oskaloosa County, if you had reason to believe a kid might be suicidal and they tell you no, you've still got to contact their parents and say, we were worried about your child. But when I asked him directly, he or she said, no, they're not suicidal. And in other cases, it's like the professional just didn't take enough steps to work towards safety. And very importantly today, we must use what are called written safety plans. We used to use a no suicide contract. Just sign right here that you won't harm yourself. Well, what's the problem with the no suicide contract? It's all about what not to do. safety plans, which should be written. Look at internal and external things. What could you do this evening if you have those suicidal thoughts again? And obviously 988 would be a very big part of what should be on that plan, as well as the crisis text line. So we need to learn some lessons from some of those tragedies that have happened. Okay, moving on. What age group is the most at risk? I've given you some hints, but right now turn to whoever's closest to you, like Chaz, tell Pam, what age group is the most at risk for suicide in America? So I'm hearing the right answer. You're actually looking at the highest risk group in America. That would be an old man. And if they have family, health, and financial problems, those all greatly contribute to the high suicide rate for the elderly. All right, now, this one just shout it out. What states in America have the highest suicide rates? Go ahead, shout it out. Over here, I heard New York. I want to say something. I spoke in New York City recently. Those people are not suicidal. They are homicidal. That's my attempt at a little humor today, and I meant to begin with 3 rules for speakers. Number 1, never ever go over the time allotted. Pam is right here. She's going to give me the time warning. Number 2, don't talk about anything not on the handout. And number 3, do not depress the audience, okay? So our theme is hope, and we're looking for, and there have been great strides, but I actually heard the correct answer. Alaska, Montana, Wyoming, they're always number 1, 2, and 3. We could spend hours on this, but you're immediately thinking rural nature, lack of mental health services. You might even be thinking seasonal affective disorder. You might also be thinking high percentage of Native Americans. Yes, that's true, and they do have a high suicide rate. You might be thinking about the fact that in those states we can pretty much guarantee a gun in every home. But you maybe didn't think about the high altitude theory. There's some data out there saying when you live at 5,000 or 6,000 feet or more above sea level, you might not be getting enough oxygen, and your antidepressants, if those are prescribed for you, may not be working. In South Florida, I think I'm like 8 feet above sea level, so there's not any problem with altitude there. In fact, we're worrying about South Florida basically flooding someday. Oh, I did it again, okay? So now, okay? Michael, apparently I just do not have the silver button right. Oh, okay. So, okay, you'd think I've only done this once before. Okay. Now, here's another question for you to answer. Tell somebody it's your neighbor there, by race and gender, who is the most protected against suicide? Who is it? Because this is where the hope is, right? Who has the lowest suicide rates in America by race and gender? Absolutely correct, Nikki. African American females. Then the question is, of course, why? Sisterhood, faith, purpose. It's so important for all of us to take a cue from that and have sisterhood, brotherhood, purpose, and faith. So I do a newsletter at the Suicide and Violence Prevention Office, and I've been blessed to interview some of the leaders in the field of suicide prevention nationally. Dr. Berman is a giant in suicide prevention. What's he really saying? We don't fund suicide prevention the way we fund trying to do something about the other leading causes of death for suicide. Sometimes the people making the decisions might say, oh, they were just cowardly. You know, if Thomas Joyner was here today, he'd say, they're not cowardly, they're fearless. Overcoming the most basic instinct we have, which is to stay alive, is pretty hard to do. We need to increase funding. Dr. Anestis, who I interviewed, wrote the book Guns and Suicide. Guns are only used in 5% of suicide attempts nationwide. They result in over 50% of suicide deaths. So what's one thing I hope you carry away from the conference? Removing the lethal means from the ready access of a suicidal individual will dramatically prevent suicide. I remember a goodbye note that a Houston teenager left to her parents. It said, "Why did you make this so easy? Why did you leave this gun available to me?" About 97% of the time, if somebody uses a gun, they die. The good news is if they use other methods, they almost always survive. And all of our national data says something like this. 90% of those who survive a suicide attempt never go on to die by suicide. And there is Dr. Joyner, who is an eminent professor at FSU, and he's right. We got to be careful that we don't overestimate protective factors, underestimate risk factors, and take the proper steps for safety for our clients. I also interviewed Dr. Jobs, and I'll preface this with saying, okay, I teach an APA-accredited clinical psychology program. By the way, a program I could never have gotten into. I feel lucky to teach there. Now, the bottom line is that my course, it's an elective. It costs them extra money. It costs them a lot of extra money. Basically, competency in suicide risk assessment and management is not a requirement to be a licensed psychologist, licensed counselor, licensed social worker. It's like hit or miss. Wouldn't the average person think if you're going to see a licensed mental health professional that they would know suicide risk assessment and management? They might, but they probably had to seek it out on their own. Or hopefully, maybe they learned a lot about it on internship, for example. So it is true, there's a shocking lack of curriculum training across disciplines. So now, I've already talked a little bit about Bob, but I do want to give Dr. Brian credit for his book on rethinking suicide. And he basically draws an analogy. You know, for my entire life, up until 3 years ago, you know what the leading cause of death was for a kid in America? It was a car accident. You know what the leading cause of death is for a kid in America for the last 3 years? It's a gun death. Homicide, suicide, or accidental discharge of a gun. So what he points out in this book, we made a lot of strides to reduce the accidental deaths in cars for Americans. And he also stresses something I think is really important. Small reductions in risk factors and small increases in protective factors can make a huge difference. I'm excited to know that at least we're talking about this a lot more in the schools, workplace, families, and the places of worship. And the other point that I skipped over there, which is a challenge, how do we make life worth living for all Americans? When I gave the example of Bob, he was an old guy, no living relatives, couldn't go back to work, didn't have a purpose, simply didn't have enough money to live on. So now if we just quickly review Joyner's model, lots of people have this low or thwarted belongingness, and maybe they even perceive themselves as a burden to other people. But they have to acquire the capability of suicide. They have to work up to it. So be alert for somebody that might have some strange injuries. They were trying to jump from one place to another. They might have an extreme eating disorder. They might engage in self-injury. And actually, when we use the term non-suicidal self-injury, that pretty much says to us, oh, they're never going to become suicidal. Unfortunately, a lot of them become suicidal. Self-injury, which regulates emotions and releases endorphins, is not working as much as well today as it did 6 months ago. And Joyner would say they're habituating. They're on a continuum and might ultimately make a suicide attempt. So you know what I wanted the answer to? What should I look for? If young people are engaging in cutting and burning to superficially injure their bodies, well, have they done this for a long period of time? Have they used multiple methods? Do they disassociate when they self-injure? And do they experience little pain? Those are all of the things to be looking for, as they very well may be moving on a continuum of ultimately making a suicide attempt. So I was sitting there today, I'd want to know what works. This is what the World Health Organization says. I think I pretty well covered the first two. Now, let me share with you that, and how many veterans do we have here today? I'm just curious, okay? You know, frankly, one of the happiest days of my life was when I got out of the Army 53 years ago next month. I was drafted, but proud to do my service. I made 3 really great friends in my medic platoon. And, you know, we went to each other's weddings. We were aware when we all started having children. Wow, we kept in track and in touch for like 30 years. Then I realized 20 years went by, and I don't know where those 3 guys are. Pretty quickly, I found 2 of them, but I didn't find Bart, who went back to Chicago and became a fireman and a medic, but then I had no idea he left Chicago. I was trying. I finally hired a private investigator, and he got a phone number. I left a message. I got a call back from Mary, his wife. They had moved to Colorado. She said, "You are 8 months too late. Bart shot himself. He couldn't transition to retirement. He had severe sleeping problems. He kept going to the doctor, but that didn't help." Now, of course, I wished I'd have tried and I'd done more earlier. My wife tried to cheer me up, saying, "He could have found you in 15 seconds. All he had to do was put your name into a Google search," but I couldn't find him. Now, I want to be hopeful, but here is a rather troubling example. I actually get my medical care at the university, and I have to wait a long time because like a 4th-year resident is doing everything, and then the licensed physician comes in and reviews everything. So just last week, I'm mentioning to the 4th-year resident what I do, which is I direct the Suicide and Violence Prevention Office. She goes, "Oh, suicide. Us doctors, we don't really want to get into that." About 70% of the time, the person of any age who died by suicide went to see the family physician. I know my father did. He was being treated for a minor heart condition, but obviously there was a lot more to that picture. Now, I'm excited to tell you the last 2 years, and for this coming year, we're going to train every medical student at Nova on suicide prevention. But I wish I could say we were doing that in every medical school across the country. And unfortunately, I don't think we are. But physicians have a very big role to play. I'd be remiss today not to at least show you those warning signs. Many of those were mentioned earlier. We do know with adolescents, though, they're just like overwhelmed. There's a lot of pressure on them. And sleep deprivation is a real issue, especially for adolescents. Our high schools start way too early. They go to bed with all that technology. They get awakened during the night. My latest thing is a project for the state of South Dakota, youth mental health and social media. We could go into that for a very long time right now, but I'll just alert you to tremendous concern. The Surgeon General put out an advisory about youth and mental health and social media. Let me sum it up for you in one sentence. Social media is wreaking havoc with our children's lives. Make them think they're not smart enough, good enough, nor rich enough. There's Means Matter from Harvard with research all around the world on the importance of removing access to lethal means. Very positive note, How many of you have actually been to the Golden Gate Bridge? I'm curious. I think it's one of the most beautiful places in our country. But it was the single scene of the most suicides in America up until recently. After years of debate, that net just below the bridge is finally in place. And it's already demonstrated that it is saving lives. And maybe the most famous study of the Golden Gate Bridge was done by a guy by the name of Seiden. 515 people were physically stopped from jumping from the Golden Gate Bridge. By the way, they were asked a pretty obvious question. You gonna go home and get a gun now? You gonna go to the Oakland Bay Bridge? 100% said, it's what I wanted to do at that moment and that moment only. That moment has passed. Now I want to live. So Seiden followed those 515 people for the next 25 years. Now, if you believe suicide is somehow destiny or inherited, you would expect, given the trials and tribulations of 25 more years of life, that a large percentage of them would have died by suicide. I wish I could tell you it was 0. It was 4%. So remember, 96% were still with us 25 years later. That's where the intervention of any one person and being comfortable asking them direct questions can make all the difference in the world. I'm a big fan of a Suicide Prevention Resource Center. They do, in fact, have training, calm, counseling, access about lethal means, and some hopeful things. There's more movement to get people to secure their guns. By the way, we're hosting the AFSP Out of Darkness Walk on our campus in 2 weeks. I will be there, and I'm proud to tell you I'm doing the welcome, but at Suicide and Violence Prevention Office, we're going to be giving out gun locks. And around the country, there are, particularly in the West, there's a movement to provide opportunities for the gun owner to store their gun when they know that for their own personal reasons, it should not be in their possession right now. And more gun shops have little posters up about warning signs of suicide. All that is very hopeful. What protects against suicide? The answer from the World Health Organization. I began with talking about connections and how important those are. Caring and problem-solving, coping and problem-solving skills. I like to give the example of our son, Jeremy. He was 8 years old. Jeremy, I need to talk to you a little bit more about the death of your grandfather. He says, I'm sorry I never met him, Dad. He died well before I was ever born. But you already told me he had a heart attack. That's true, son. He did have a heart attack. But there's more to this story. And now that you're 8, maybe you can understand this. 2 weeks after his heart attack, he shot himself, son. The word is suicide. He looks at me and says, you lied to me. No, I was just waiting to give you the complete information. Now that you're 8, maybe you can understand what that word suicide means. Then he thinks a minute and he says, oh, you shouldn't feel guilty. Oh, why is that? Well, your dad wasn't a psychologist like mine. He didn't teach you all the things that I know about how important it is to feel good about yourself, Dad. Every kid has problems. You just have to know you'll get through it, and most importantly, go to an adult and get help. Wasn't that sweet? He was trying to alleviate my guilt. What's the most important point? He's 8 years old. He's a problem solver. He knows the importance of seeking adults. And by the way, he's a minister today. Do you know he just had his 9th child? Would somebody please tell him to stop? Michael, I've got 21 grandchildren. None of them even live close to us. I got to keep working a long time. The birthdays, the travel, it's a lot. Okay. All right, moving on. Yeah. I want to call your attention to the tangible hope box, which is something that helps people a lot. They put things together, memories, things that are meaningful to them. And of course, there's the virtual Hope Box app that we can put on our smartphones. There's basically an app for everything. One app that I'll take a moment and publicize is the SAMHSA Suicide Safe app. I have it on my phone. If somebody's walking somebody down to see me, and I understand they might be suicidal, I'm probably opening up that app. It has the safety on it. It has case studies and can guide us through that process. There are a lot of challenges out there. You're aware of these in rural areas. We talked about that last night. Pretty much there's still a lot of stigma about seeking mental health services. This is very true in some of our cultures, where getting help is seen as somehow a sign of weakness, where we need to view it as a sign of strength. And I want to do one quick example to make a point, and Pam doesn't know that I'm going to pick on her for this, but I want you to imagine that Pam is a 14-year-old girl. She is devastated by the breakup of the first significant relationship in her life. I'm the well-meaning adult. Pam, I'm so sorry that this happened. I'm sure today seems really difficult, but you know, time pretty much has a way of healing everything, Pam. Would you mind me telling you what happened to me when I was 14? I mean, I got through that, Pam. I mean, I'm going to be 76 soon, and I'm really happy. You are going to be okay. Just trust me. One day at a time, things are going to be so much better soon. By the way, did I help her? Did I really even focus on her? I mean, I overplayed it a bit, right? Was I dismissive? Yes. Did I give her some lifelong lesson about my life? Yes, I did. And I know that I overplayed it, but I'm actually being very serious about we have a tendency to minimize. A kid in Montana, you know what she says to me? You know how I can tell my mom isn't really listening to me? She told me what to do. I haven't even finished telling her everything that's going on. So finding that shared time when kids will truly talk to us. And I learned as a dad, when I asked too many questions, all of a sudden they quit talking. So it was more about just being present with the shared activity. But if you don't mind me telling you, when I was 14, Doris Nelson broke up with me, and I know she is still sorry. Michael, she started dating a senior in our little town in Kansas. She married that SOB. I mean, it's like I never even got to talk to her again. I am over it. But I couldn't even find her on Facebook last week. All right, moving on. My attempt at a little humor for you, okay? It'd be important that you see those slides to try to debunk the myths that are holding us back. Sadly, you know what I sometimes hear from a superintendent or a principal? Oh, we just better not bring up suicide. We bring it up, it's probably going to start happening. Well, unfortunately, it's on the mind of middle school and high school students all over the country. And what I actually hear pretty much from every corner of the U.S., more and more 4th and 5th grade kids are talking about suicide. And then the question is always, do I take it seriously? Yes, every single time. Follow your procedures. Now, about 21 states have legislative mandates for suicide prevention in schools. Florida does not. Florida does have a suicide prevention certification process, which I always emphasize, but I've tried to get legislators together with like Clark Flatt, who founded the Jason Foundation, to try to get movement in Florida, to have some basic requirements for training school staff, what to look for, what to do. Don't keep a secret, work as a part of a team, have a policy and a procedure. So there is a relationship between bullying and suicide. This is what a lot of the lawsuits against schools are about, and I've been involved in a number of those. So what do I want you to remember? Strong association between suicide and bullying. A kid that's a victim of bullying, we shouldn't hesitate to ask them thoughts of giving up, hopelessness, and thoughts of suicide. And I already talked about the relationship between suicide and self-injury. Now, if everybody would just glance at this for a moment, that could be a freshman here. Hey, maybe it's a high school senior. He just banged his head against the mirror. Ever since the breakup, I haven't been able to study. I just found out I'm losing my job. I'm not sure I want to live. Turn to your neighbor for a second. How do you think every American should respond to somebody who just says, I'm not sure I want to live? Take a moment. How would you respond?
I would ask the tough question, say, yeah, have you actually thought about doing it? Have you made a plan? No. And then I probably ask them.
Thank you very, very much. I'm overhearing some of you, and you're doing an excellent job responding to they're overwhelmed, they're in pain, they're not sure they want to live. You're asking directly. By the way, do we have to have a master's degree, a specialist degree, a doctoral degree to know to just reach out, listen, and not be afraid to ask direct questions? That is what will make the biggest difference for suicide prevention. If everybody could do this. And as I said in the beginning, I wished I'd known enough to just ask my dad, are you telling me you want to kill yourself? Is that what you're saying? So we need that to be something that all of us are comfortable doing. And of course, staying with them, getting them help, encourage them to seek out help. Maybe it's driving them to the emergency room. Maybe it's walking them into Michael's office, staying with them. Maybe it's picking up the phone, calling 988, taking steps to keep them safe, taking this seriously. I often say something like this: it can happen. It has happened. There was a 14-year-old girl who killed herself in our area recently. We've got to take these warning signs of suicide very seriously. Okay, I talked a little bit about safety plans and their importance, and this really needs to be a part of training for nurses, psychologists, counselors, social workers, family therapists, and it's all about getting something down in writing. What could you do if you have those suicidal thoughts this afternoon? It has to do with internal. What can you do when you're all alone to calm yourself down? It has to do with external. Who can you contact? And hopefully they know how to use 988. They know how to use Fortify Florida. They know to get help for themselves. And these need to be written. I like to sit side by side with the person. We're working on this together. They get a copy, and if it's a student, clearly I want their parent to have a copy. I ask them to take a picture, store this on your phone, and every time I follow up with you, I'm going to be asking you about the safety plan. What other ideas do you have to put on that safety plan? And a very common phrase, it's on the Brown and Stanley, but it goes, tell me your reason for living. Have you ever had somebody tell you none? So my suggestion is that be rephrased. Thankfully, something has kept you alive thus far. Let's write that down. Let's get that down. And you know, responding to a lot of tragedies around the country, mostly I'm a listener, but when appropriate, I ask this question: who or what has helped you when you've had to deal with something sad before? Who or what can help you now? And I'm just trying to connect them with their existing support systems. And if there were magic words, I would certainly tell them to you. But you know, as close as I can come is, I'm here for you. Anytime you want to talk, I am here to listen. And I'm sad to tell you a number of the Parkland parents have said things like this. Even the people closest to me tell me I should be over this by now. What we should be saying is, I cannot imagine what you've gone through. I am here for you anytime that you want to talk about it. I am here to listen. So pretty well covered that. And all of these are key points that should be a part of safety planning. I think we could save a lot of lives just in our mental health offices if everyone was utilizing safety plans. And if we referred individuals to mental health professionals that we know are competent. In fact, I'll never forget a dad in Omaha, Nebraska saying, I did exactly what the school said. I took him to see Dr. So-and-so they recommended. He told me my kid was a typical teenager. 2 weeks later, he was dead. So we need to make sure we're referring to people that are skilled and keeping up with the literature. That made me think of a conversation I had with the dad last fall. And, well, it wasn't a tragic one, but so he says to me, how do I know my daughter, who's a high school senior, is really depressed? I mean, she's withdrawn, she's moody. I mean, that's just being a typical teenager, right? Well, Dad, let me ask you some questions. Has this gone on for 2 or 3 or more weeks in a row? Yes. Is this affecting every aspect of her life? Homeschool, friends? Yes. Has she dropped out of something that was previously very pleasurable to her? Yes, she has, as a matter of fact. She was on the dance team for the first 3 years of high school, but this year I couldn't believe it. She said, as a senior, I don't care about it anymore. Well, Dad, it's pretty likely that you have a depressed teenager. You know what the literature actually says? 20% of all teens suffer from depression at some point during those tumultuous years, but about 80% never receive any treatment whatsoever. I mean, I worked full-time in the schools for 26 years. School social workers, counselors, psychologists, mental health professionals, they are doing their best. We don't have enough of them. I presented in Hillsborough County 2 weeks ago. They currently have openings for 50 school psychologists they cannot fill. We have lots of openings for school counselors and school social workers. I don't see an easy answer. We've got to attract a lot more people to mental health professions in schools and hopefully provide a work climate that they want to stay there. I mean, that's the place where kids are half the days of the total year. It's a place where we could provide a lot more mental health services. Now, survivors of suicide, like me, and many of you here, I know that you lost a loved one to suicide. I still remember going to that very first grief group. We go around the table and somebody tragically lost their twin brother in a car accident. Somebody else shared the death of their mom to cancer. And I go, my dad shot himself. See how I immediately felt I wasn't in the right place? What I find helps survivors the most is when they are with other survivors, survivor support groups. But I sometimes have a lot of difficulty getting the family to participate. And the mom will say, nobody can hurt the way I hurt. I remember this every Saturday night at 9 o'clock. That's when she died. Mom, if you will give the survivor group a chance, everybody there lost a loved one to suicide. They're online suicide survivor groups. In a place like South Florida, of course, we have several options, and they can go in person. But in rural areas, it may need to be a virtual online survivor support group. And I remember being in Omaha, Nebraska. And why did I go there? Youth Suicide Point Cluster. and meeting the local survivor group. This is what they said to me. When we hear of yet another family lost a loved one to suicide, we just go knock on the door. And we express our condolences. We tell them about our survivor group, and we invite them to be a part of it. I got a chance to go to one of those meetings, and that group was like so, I guess the word is so strong and so supportive of each other. And so there is the website for the online suicide survivor support group led by a person I respect, Joanne Harpel, okay? And pretty well covered most of that, except we've had a tendency to underestimate the impact. We now think that when somebody dies by suicide, it affects about 135 people at some level, but it profoundly affects about 18 people. And they're the ones, many of them are out here exhibiting, they're the ones organizing the Out of Darkness Walk. And last year, the one on our campus raised about $70,000. And everybody has the different colored ribbons based on their relationship to the person who died by suicide. Now, there's a simple point that I'll reinforce right now. Today, I have avoided the word committed, haven't I? Just know that died by is a lot more acceptable to us survivors. Seems to imply even a 13-year-old kid traveled a long road. They did. We could say it's everyone's fault, yet it's no one's fault. And by the way, the answers pretty much died with them. The focus always has to be on the survivors. And if I give you a school example, would you think that if a kid died by suicide, now his closest friends would be at risk? Well, not really. Most commonly, who is most at risk is someone that barely even knew the suicide victim. They just have their own sad set of circumstances. I get calls like this. I am the 9th grade counselor. We lost an 11th grade student to suicide last night. As the 9th grade counselor, I've worked with 7 kids known to be suicidal. Do I need to see them today? You see how easy that question is to answer? It's now much more on their minds. Barriers and inhibitions are down. And unfortunately, adolescents are the most susceptible to imitating suicide behavior. By the way, nobody ever said do nothing in a school after a suicide. No one said do nothing. Help everybody with their grief, their shock, confusion, and yes, maybe even their guilt. Years ago, do you know what 4 kids told me on a Monday morning? We told Sarah Saturday night was the night she was supposed to die. We knew she had her dad's gun. We told her where to put the gun, pull the trigger. Those 4 kids are going to remember that for the rest of their lives. You know what the counseling department documented? Sarah called 24 friends, telling them all she was going to kill herself. Finally, one of them awakened her parents at 4 a.m. in the morning, but it was too late. So if we actually were teaching all of high school students what to look for, what to do, how do you help a friend? This is nobody's fate. It's nobody's destiny. Now, if you follow this, you might be aware that a young lady named Michelle Carter in Massachusetts went to jail for 15 months. She told Conrad Roy, get back in the car. You know you want to kill yourself. Now, I actually view it as more of a moral issue than a criminal one. But education for everyone. Isn't it horrifying to think somebody would actually encourage another person to end their life? Okay, so very important that we provide support for survivors. You all get out there, you advocate, you connect. In fact, you know what my hope would be? That many of you have met somebody here today that you did not know. And Michael, I want to compliment you for bringing all the people that were exhibiting out here, letting them talk, because I've been to countless conferences where hopefully people go by and talk to them, but they were never really introduced to the entire group. So thank you for doing that. Volunteer. There's Out of Darkness walks happening at least 2 places, not too far away, within the next few weeks. I hope many of you will be out there walking and raising money. So in Broward last year, I remember seeing the entire family had a t-shirt with Emily's name on it, walking and raising money. I saw an entire cross-country team walking with Jake's name on their t-shirt, raising money and feeling like they are making a difference. They are making a difference. You are all making a difference. So, moving towards the end of this presentation, this is a time in America we all need to know warning signs of suicide, what to look for, what to do. I think I could go on right now and list, there's a lot of things in this world to be worried about right now. And most recently, severe hurricanes that were frankly devastating to thousands and thousands of people right in our own state. We need to talk about suicide prevention more. We need to bring more people to conferences like this. We need to help people not be so afraid to bring it up. And you know, if somebody has been hospitalized because they're suicidal and now they're out, let's say a month or two's gone by, you know, probably the one thing that their family never wants to bring up again is they just don't want to ask. That wouldn't they be saying, oh, thank God that's over. But it's not necessarily over. They need to find that shared time and sit down with the person and gently ask, have you ever had those thoughts again? It wouldn't be that unusual to have those thoughts. What could you do if you ever have those thoughts again? So we can't view it as something that absolutely should never be discussed again. And we really need to listen to those that have a lived experience of being suicidal and be that good listener. And I wish we would focus more on making life worth living for everyone. Having been at this a long time, and I've had the opportunity to testify in front of Congress about suicide prevention, school violence, and children's mental health, do you know what I think? And I'm being very direct here. We elect the wrong people to Congress. They don't have any idea what you see in Oskaloosa County every single day and how much you see families that are struggling. And a lot of Americans are. And some Americans have so much, but some, like Bob, had so little. And how can we really do something to raise the quality of life for everyone? And obviously, I would love to see suicide prevention funding significantly increased. I am delighted to know that more and more mental health professionals are seeking out training in suicide risk assessment and management. I know there's quite a movement to use safety plans and to get rid of the idea that somebody just signs here that they won't die by suicide and we don't give them any tools or direction. Now, I have been a licensed psychologist in Texas for 42 years. Do you know that I've never had to take 1 hour of continuing education on suicide risk assessment and management to keep my license? Increasing numbers of states are requiring it for license renewal. I wish it would be required for license renewal for all mental health professionals in every single state. I believe there's at least growing awareness of the importance of securing guns in our homes, at least growing awareness of the importance of enforcing red flag laws. And we had the first parents in history in Michigan go to jail. If you don't know, their child was clearly very disturbed. They bought him a gun. They walked out of the conference with the counselor. She told them, take him home right now and get him mental health treatment. They walked out. He got the gun out of his backpack. He killed 4 people and he wounded 7. They're in jail. And I do support accountability for those that are not responsible with their firearms. All right, let's look at those U.S. Department of Health and Human Services strategic goals for suicide prevention. All right, we got a federal plan recognizing the unique challenges faced by so many Americans. The influence of social media, the pandemic, which did kill more than 1 million Americans, okay? Substance abuse, disparities among various populations. They identified those groups that you see there as very high risk. LGBTQ plus individuals, racial minorities. I'm very sorry to tell you the suicide rate has gone up for black children in America. And Native American adults have had a dramatic increase. Decades ago, I led a team on the Red Lake Reservation in Minnesota after a school shooting. I had never seen anything like the quality of life on that reservation, the lack of hope, the broken families, the substance abuse. Frankly, I could not believe I was in America when I looked at the quality of life there. And I did a big project for the state of Montana on suicide prevention, and they were like, you know, we've got like 11 tribes. Maybe you could meet with the 11 tribal leaders and talk about suicide prevention. And I was like, who in the world could do that? I mean, first of all, I'm not a Native American, so that's not going to give me much credibility with the representatives from 11 different tribes. But the suicide rate for our Native Americans is quite high. A comprehensive approach from the community, national, state, tribal level, those are all of the key points. Now, somebody can correct me, but I was trying to look for, I'm obviously delighted about 2024 national guidelines, standards, and focus on suicide prevention, but I couldn't tell that there was any funding. So we may have to focus on that at the state as well as the national level. But I'm delighted that they've outlined all of that. And then I wanted to call your attention, I found this workbook from Catherine Hope Golden really meaningful. And I love the fact she took that word hope and she made every letter stand for something. Obviously, help seeking, very important. Being optimistic about the future. My own kid at age 8 saying, you just have to believe whatever happens, you're going to get through it. You'll get help. You'll go to adults for help. And helping change our perspective and just working on things in our life. And I know this is going to greatly oversimplify something, but at my advanced age, you know what I think life is all about? It's about meaning. Meaning in our relationships, with our family, our church, the workplace, our friends. And I'm really concerned when somebody just doesn't have enough meaning. And I encourage young people to volunteer. I encourage those that have retired to volunteer. In fact, I'll give you my favorite quote about an adolescent. Perhaps the only way they can find themselves is through service to other people. And without a doubt, this is a group that's incredibly involved in servicing other people. You know something I'm really proud to tell you that 50 years ago this month, I signed up to be a big brother to Rodney. a 13-year-old black kid in Muncie, Indiana, who never knew his dad, and his mom was on welfare. Rodney and I have not communicated since last week, okay? Rodney is 63 years old next week. But I have been involved and stayed in his life the entire time. Some of my friends have said, why are you still involved with Rodney? Why are you still helping him? Because financially he struggles, because all he had was a high school diploma. He's been a cook, he's been a custodian. Why am I helping him? First of all, because I can. Secondly, because I care about him. And it's not like he's wasting his money. You know what Rodney said to me? Scott, it's pretty hard to make it when the most money you've ever made in your life is $25,000 a year. Yeah, it is pretty hard to make it. And I'm going to be there for Rodney as long as I'm alive. And I have learned so much and gotten so much out of that relationship. So emotionally, I feel good about what I've been doing now for 50 years to help Rodney. And by the way, do you know what the wait time is to get assigned a big brother in America? Try 4 years. You sign up when you're 10 and somebody calls and you're 14. You don't care about it anymore. You know what the wait time is to get a big sister in America? Try about 4 months. That's because women step forward much more often than men. And I'm proud to tell you, our youngest daughter has known Rodney her entire life. As soon as she graduated from law school, she signed up. She's a big sister to Anna, a 12-year-old girl in Houston, Texas. So getting involved, staying involved, and helping others is good for all of us. All right, so I want to thank you for everything you do. I know you make a difference in suicide prevention. And for those of you from Oskaloosa County that I met, so the website at the university, yes, I developed the Florida Steps, School Toolkit for Educators to Prevent Suicide. It's based on my 40 years of working on youth suicide prevention in schools and communities. It is 186 pages, 32 tools, divided into prevention, intervention, and postvention. Thanks to a Florida Blue Foundation grant, I have the funding to provide training to schools in the state. I can rent the venue if I have to. I can feed them, and they can all walk out with a copy of the Florida Steps. I'm a very big fan of the Jed Foundation, which has done a lot for suicide prevention and mental health, particularly at the college level. I'm a very big fan of the Trevor Project. The suicidal behavior for LGBTQ plus youth is extremely alarming. And thank all of you. Here are some other resources, and I'm going to turn it back to Michael.
So don't sit down yet, because we want to make sure that if people have questions, that they can ask. Do you have questions?
A while back, Larry and I saw a documentary on Mount Fuji where people go in Japan to commit suicide. And I wondered, why is there nobody there trying to help those people?
Okay. Pam is talking about what's called the suicide forest. And people, Mount Fuji is like huge. They basically get in there. Apparently so many trees, it's like maybe even if they've changed their mind, they can't find their way out. But around the world, there are people, particularly in China, there's a retired guy who spends most of his waking hours by the bridge. And if somebody looks like they're distraught and they're walking to the bridge and might jump, he just approaches them, mostly gently and listening. So I don't know why they have not done more with regards to what's called the suicide forest. But a very positive note is there are people in various places in the world trying to be very vigilant and be there and just approach people. And you're probably all a big fan of Kevin Hines, who survived jumping from the Golden Gate Bridge. But Kevin shared that it's like, when I went to the bridge, if one person had just seen how upset I am and one person had reached out to me, I wouldn't have jumped. He said the tears were streaming down his cheeks and people said, take our picture. He said, I took their picture, but couldn't they see how upset I was? So this is just a basic skill for all of us across the world to recognize when somebody is really in trouble and reach out.
So some of your comments, listening to like from the beginning, saying people who want to commit suicide will lie, and some of the other things that you mentioned, I'm wondering how much faith you actually put in suicide assessment scales. For somebody like me as a school counselor, I've been in schools where you're forced to do them, and I feel like they can be very inaccurate. So.
Okay, she has raised so many important points. Now, I'm very familiar with the American School Counselor Association position. I have been on cases with Carolyn Stone, who's your ethics guru. She wrote your ethics book. Now, there's more school counselors than anyone else, more of them than school psychologists and social workers or licensed or mental health counselors. So what do I want to say to you? School's role is an initial screening. And I am a fan of using something standardized like the Columbia. But the screening is really about what is the needed supervision right now. Can this kid walk out of my office, be back in his class? Maybe not. He needs to be either right next to me or I have this staff member over here totally supervise him. I am calling the parents and I am recommending safety-proofing their home, seeking community-based mental health treatment for their child. We can't guarantee their safety. We can't be absolutely certain they're even telling us the truth. But we had some reason to ask a kid in school about suicidal behavior. That's why I used the example, Mom and Dad, he said he wasn't going to harm himself, but you need to know that. And for the most part, they want to get out of your office. They want to get out from under your scrutiny. So I believe school counselors have a very important role. Hopefully you never feel like you're working in isolation. You're getting collaboration or supervision, and you're simply documenting every step you're taking. And this is exactly what I put in steps, tools for you to document. That's tool 16. A safety plan is tool 17. A parent notification form is tool 18. So thanks for bringing that up because that is very challenging. But school counselors, I believe, have an essential role of gathering some initial screening information, then working as a team. Also, so important to tell your principal to make sure they are involved and hopefully supporting you at what is a very anxiety-provoking time for you. Any other questions? Okay, Nikki has a question.
So given the hurricanes that we've had, can you speak a little on compassion fatigue and how that impacts first responders and their suicidality?
Absolutely. And you know, Nikki, I went to Oklahoma City right after the bombing as part of a national team. And I'll never forget, I mean, he was extremely well-liked, wonderful responder, and he ended up dying by suicide. So yes, we have to, whatever we can do to try to thank people, support them, get them sleep, get them good nutritious food, and hopefully rotate them out so that after a couple of days, they need a break. And now they're away from their families. And so hopefully we can keep having new waves of these important responders coming in. And having led some teams for the National Organization of Victim Assistance, they pretty much have the policy 4 days. 4 days and you need to go home. We'll send another team And also, they don't want a community to become dependent on the same individuals. They're going to send another team. And I also remember the hardest thing for me was going back home. Nobody had any idea what I went through. And I remember walking into my office after being gone for 4 days responding to a school shooting. And a parent called. And the parent was complaining about the crappy psychological services their kid was getting in schools. And at that moment, I just didn't care about that. I mean, I did my best. I really wanted to just take the phone and throw it across the room. But so the adjustment back to families, which is a very big issue for active duty military personnel. They've been gone a whole year. And now, maybe their kids aren't relating to them the way they had hoped. Maybe there's some changes in the relationship with their partner. This is a critical time, the transition back to just doing your normal job and your normal role in a family.
Someone else?
Good, thank you. Oh, okay. Sit down.
It's okay. We're glad you're here.
I'm glad to be here. I have a question because I have 4 kids who are aged between 9 and 18. Hey. Hey.
Okay, with my minor hearing loss and you know what?
Was it not loud enough?
The audiologist told me, Scott, those hearing aids don't help you if they're in the case. Okay, so I'm going to move a little closer here.
Hi, Scott. I have 4 kids who are aged between 9 and 18, and I was wondering what are some additional resources that I may be able to provide to them. We have a ton of kids who rotate through our house because of it. What are some additional resources that I can give to them to be able to identify some of this amongst their friends, or to be able to prevent or notify? How can I help arm them?
Okay, all right. So she's talking about her own children are 9 to 18. She has a lot of kids that come in and out of their house. You know what one of my favorite questions to ask a kid? Who is your go-to trusted adult at school? And when do I get concerned? If they don't have one. But let's say they tell me it's Coach Pinkle. Well, what is it about Coach Pinkle that would make him be your go-to trusted adult? Usually they'll say he's approachable, he really cares about us. Then what could be the situations where you should go to Coach Pinkle as quickly as possible for help? I'm hoping they tell me. Somebody said something about suicide. Somebody's talking about bringing a weapon at school. Somebody's talking about harming other people. So go to trusted adults, and you very likely might be that person for a lot of them if they keep coming to your house. And then I could go on about this for a very long time, but it really has to do with screen time and social media. I got to go, we have one daughter who married a very rich man. So I got to go to the private school where all 6 of their children go. With my own daughter sitting there, the message was really, don't be in a hurry about smartphones and technology. Let them be little boys and girls as long as possible. And of course, every kid in the world who's in the 5th or 6th grade is going to say, every one of my friends has a smartphone. Well, there's actually an organization out there called Wait Until 8th. And it connects like-minded parents who would be able to say, well, as a matter of fact, Beverly's mom and dad, they're in this organization. They're not in a hurry. Now, parents all say, got to be able to reach my kid in an emergency, okay? Do you know you can buy your kid a watch that allows them basically to make 5 calls? They don't need $1,000 Apple Watch to be able to call mom, dad, grandpa, 911, 988. But we've gotten this tremendous hurry. I saw this at the restaurant last night. What's like the first thing parents hand a little kid when they come into a restaurant? Their phone, okay. What about they just talk to members of the family? I mean, would that be impossible for an hour? You know what I hear from moms? It's my husband. I mean, I know the value of a technology-free mealtime, but he won't turn off his phone even for 35 minutes while we eat dinner. So blackout dates in our schools, blackout dates in our home, just trying to maybe get back to more reason about technology. I mean, I grew up in a home where there was one telephone. It had a cord on it. Does anybody remember that? And the beauty of that was we always knew where the phone was. And when I would walk in from high school, nobody could reach me. I mean, if they called, my mom would answer the phone. She would hand it to me. She didn't move. So now I'm standing next to my mother talking to my friend. Did we have a long, anguishing conversation about anything? No. So maybe just get back to, and I was just in Iceland, and a couple things in Iceland like really surprised me. One thing in Iceland is that Thursday nights for decades there was no television. It was like they wanted everybody to talk to each other. Now there's kind of a novel idea, but if we could translate that into one night or maybe just a couple of hours, everybody turns off their technology, we talk to each other, maybe we get out a board game. I mean, that is simpler times, but if we just weren't in such a hurry about all of this technology. You know, it's being debated at the state level, it's being debated at the national level. Some school districts are banning phones, but maybe it just all goes back to common sense in the family and parents paying attention. And kids don't take the screens into bedtime. That basically, and I had this discussion with a mom in a suburb of Atlanta, because I said something I truly believe. Tell your high school kid or your middle school kid, it's 10 o'clock now. It's time for you to get ready for bed. Hand me all of your technology devices. I'll have them charged and give them to you in the morning. So a mom stays behind. She comes up to me and says, what if my 13-year-old daughter's friend needed to reach her in the middle of the night? If my daughter didn't have her phone, she couldn't be reached. And I'm like, maybe if your daughter's friend has such a serious problem, what about she talks to her own parent in the middle of the night? So those phones are, Surgeon General's right. That technology is wreaking havoc with our children's lives. And we're going to be in this for a while, but hopefully common sense in our schools, communities, and our families, and maybe we could, you know, change this with a little less of the technology consuming our children's lives. Any other questions, Michael?
I don't know, I'm looking. I won't put you on the spot, I promise. You know, it's interesting that you say that because I've had a couple of students that I've seen that have actually made the choice on their own after we go through a session to get rid of all their social media. Mm-hmm. And the next time that we meet, they're like, oh, I am not as anxious or as stressed as I was. So there's definitely value, you know, in that media. No more questions? Okay. I don't want to keep it long. Just closing remarks. That's, I think, one of the things they said I'm supposed to be doing. Thank you for coming. Again, I can't say thank you enough because really, in my opinion, you guys are front line. If you're making the time to come, be here, to learn, to reinforce the knowledge that you already have, that's awesome. And you guys are awesome, and I thank you for that. Quick note about those of you that need CEUs, okay? Those are going to be waiting outside on the table. We've already got them done. So you should be able to pick up your certificate on the way out. Now, as far as the QPR, those of you that signed up for the QPR, it's going to be at 1:30 in room B 211. So we want you to be 211. So thank you again for coming, and I hope you all have a great day. Thank you.